So, welcome everybody. Very excited to be presenting this topic for you today. Well, Stephanie and I have presented on this a couple of times already and received wonderful feedback. And and we've made some tweaks to the presentation as a result. So we always invite you to educate us as well, because we don't know everything and we realize there's things we haven't included in here, because it's just such a broad topic. So we always invite you to educate us, if there's something that you would like for us to know, and hopefully we will provide a lot of education on what we are going to teach you. And we do invite you, like Megan and Alex mentioned, to put some questions in the chat. And just because we don't get to them in that moment, we will come back to it. So we have allotted time to be able to make sure that we enrich this presentation with your input as well. So we want to make sure that you're aware of that. Okay.
Yeah, yes, absolutely. We've definitely built in time for questions. We know that this is a very thought-provoking topic, that it affects people not only professionally, but personally sometimes. And we've just found that it really elicits a lot of observations, thoughts, questions, um, you know, input that people really want to share. So we really do, as Elise said, invite you to continue to do that throughout the presentation.
Yes, and I am just moving something around on my screen here. Okay, so, and we also realize and recognize that some of this information we're going to share can be triggering, because we're not only here sometimes for our clients, but we're here sometimes because the topic intrigues us, because it's something that we're finding many people deal with in their personal life. So just so you know, to do some self-care during the session if anything becomes triggering. Um, okay, so let's move on.
Okay, so we wanted to just start by giving you a background about who we are. As Megan shared, we've actually presented for Agents of Change numerous times before, and we've really enjoyed working with this group and working with Alex and Megan. Elise and I have done a lot of presentations throughout the country on these kinds of topics. But let me just start with myself. I'm a licensed psychotherapist. I've been in the field for close to 30 years. I am trained in marital and family therapy in addition to working with individuals. I have also been trained to be a family and divorce mediator. I am a court-ordered therapist for many courts and judges in the Philadelphia area in particular, although now I've relocated to the Florida area. So I work a lot online with those clientele still. I've led numerous workshops and presentations over the years on all different topics, but my main specialty has really come to be around supporting all aspects of families who are going through separation and divorce. I'm also a certified counselor for first responders. I'm trained in neuroemotional techniques, NET, and I taught for about 12 years at the Bryn Mawr College Graduate School of Social Work as an adjunct professor. I was a supervisor and a fieldwork liaison, and I still do supervise students. I come, as Elise does, as a child of divorce, and I bring that experience into my work with families and children, and we'll really bring that into this presentation also as well.
Okay, and I am Elise November. I have over 30 years of experience in the field as a psychotherapist, a clinician. I've worked, as probably many of you have, from hospital work to private practice to agency work. You've been in the field and you do a whole bunch of things. I'm licensed in several states. I own a company called Different Like Me, where I have probably about 16 therapists who work for me, and we all do counseling for a variety of different issues. And I also, like Stephanie, we've done a whole bunch of online and national speaking engagements. I'm EMDR and brain spotting certified. I'm also certified in transgender care, a clinical sexologist. I've contributed chapters to a book on bullying, which really lends itself and contributes to this kind of a topic. I've been the president for several terms for NASW. And yeah, as Stephanie said, you work in the field a lot and you gather a whole bunch of information and a whole bunch of skills. And that's kind of, I think, where we're at. And now we're wanting to share that with you. So let's move on.
Okay, so we wanted to just talk about, so we're all on the same page and we understand what we're going to be addressing and presenting on and understanding today. We're going to be defining and understanding the concepts of parental estrangement. We're going to be understanding the emotional and psychological effects of estrangement on both parents and adult children. We're going to be exploring the common factors that contribute to parental estrangement, including family dynamics and personality disorders, parental alienation, and cultural and political influences. We're going to understand the implications for boundary setting that may lead to estrangement. We're going to develop the ability to assess the dynamics of estrangement during clinical sessions. We're going to learn how to implement various clinical therapeutic techniques utilizing different interventions, and we're going to understand how to facilitate clinical sessions around reconciliation, realistic expectations, and again, boundaries and coping skills. Okay, so one of the things that we wanted to talk about is just to begin with, so people understand a little bit. Elise and I have many overlapping specialties and interests and niches in our practices. We were brought together by a colleague of mine in the Pennsylvania area who relocated to Florida. We really both had a big passion for teaching and presenting and bringing our knowledge in a different way, since a lot of the topics around divorce and family dynamics are not as usually as commonly presented, and we knew that was an opening that people really needed. So we came together for this, and we've partnered with various continuing education companies throughout the country, and we've created a fair amount of workshops that we've done around these topics. We're hoping to supervise professionals and train them. We're always open to people reaching out to us after presentations. We would love to have a supervision group if that is ever something that people are asking for or want. And we're hoping to create an ebook as an adjunct to our trainings. And so that's our collaboration that we wanted you to be aware of. Okay, so when it comes to parental estrangement, we wanted to start with the definition. We always think that's important, right? That we're all on the same page and know what we're talking about. And everybody might have a slightly different way of defining it, but this was the definition that we felt was the most comprehensive and the most helpful in terms of setting the stage for this topic. And its parental estrangement is generally defined as a situation in which a child, minor or adult, has a significantly limited or completely severed relationship with one or both parents. It can be a condition of being physically and or emotionally distanced from one or more family members, either by choice or at the request or decision of the other. It is generally enacted to reduce conflict, anxiety, or tension between the parties. It is characterized by a lack of trust and emotional intimacy, disparate values, and a belief that resolution is highly unlikely, unnecessary, or impossible. It involves some level of dissatisfaction by at least one party. However, it is important to note that dissatisfaction does not necessarily mean that the dissatisfied party wants to reconcile. Rather, dissatisfaction usually relates to unmet relational expectations that elicit some level of negative emotion. So that's the acting definition we're working on that we wanted to, just put everybody on the same page with today. Okay. So now we wanted to go into the causes of it. It's a very multifaceted topic. There's a lot to this. We have an incredibly comprehensive presentation today with lots and lots of information coming, from all these different perspectives, and especially because we're going to hit all those learning objectives. But some of the causes we think are really key to this, so that people understand, are parental behavior. Doesn't mean all parents are to blame for this. However, there are definitely behaviors they do that can lead to this, such as abuse, neglect, high conflict divorce, which is again one of our main areas of specialty that we know has a big impact, rigid parenting, or other harmful family dynamics that we'll get into. Another reason for the parental estrangement can be child's perception or experiences, whether a child felt mistreated, that their boundaries were violated, that they had unresolved conflicts between their parents that just felt like they kept running in circles around and could not reconcile or resolve. It can also be due to the influence of others, a third party, such as the other parent in cases of parental alienation. It can be an extended family member, a grandparent who is very unhappy with one of the parents because of a divorce or because of really dysfunctional or addiction issues in the family or mental health issues, and an extended family member gets involved and starts to, really push for a child not to have a good relationship with the parent. It can also be a new romantic partner that has gotten involved that can really put a wedge in between a child and their parent, an adult child particularly. Life transitions such as marriage, parenthood, or personal growth that shifts the family dynamics can greatly affect this and can make a big impact. We know that those major life changes can change the way an adult child in particular can feel and see the world, and it can affect their parental relationship. Okay. So, a lot of times people will say to us, well, what's the difference between family conflict and parental estrangement? And by the way, if people, just so we are all clear,
Hang on,
PE is
Stephanie.
parental.
Um, I wanna just make sure for 1 second. I'm gonna stop share.
Okay.
Because I wanna make sure that, yes. Okay. I wanted to make sure we were using the correct slide. So I'm gonna go back to share.
We
Um,
have
we
several
usually have a lot, yeah, we
passages.
usually have a lot of stats and some research in the beginning. So I just wanted to make sure we were using the right one. So apologies for the little break. And let me play it from this slide here.
Okay. We
There we
good?
go. Yep.
Okay, yeah. So we have done this in different ways for different amount of time. So that's why we have several different versions of this. At least we just wanted to check on. Okay, so again, there is a difference. Family conflict is different. I mean, family conflict is normal. It's common. It's important. It happens to sometimes help us to really understand and get deeper and closer, and we can make good shifts and changes from conflict a lot of times, hopefully, that can make us have stronger and longer lasting relationships. But parental estrangement is different. And I was saying when Elise had to stop it for a second that we're using the abbreviation PE for parental estrangement. I'm sure that was obvious, but I just want to make sure we're all on the same page with that. Okay. So anyway, the difference is that parental estrangement is usually a prolonged breakdown in it, and it can most likely result in limited or no contact. We will get into the differences of all the different ways it can present, but that's generally the difference. It is often long-term or permanent. Contact may be sporadic, extremely limited, or completely severed. Communication becomes drastically reduced, or cut off, which is the difference. There's long-standing issues such as emotional neglect, abuse, boundary violations, unresolved trauma, or value conflicts that usually lead to it in a very different way than just regular conflict. Reconciliation can be possible, but it depends on whether the deeper issues are addressed and repaired, which is different. It often leads to grief, loss, guilt, or relief, which is also different than just regular conflict. And it can be seen as extreme or unusual, carrying social stigma or judgment. Okay. Okay, so here we go into some of the statistics. Recent studies have shed light on its prevalence and demographic variations. By the way, this is actually very sad, but somewhat true, is that we have found just clinically and anecdotally that there is a trend towards this. I've talked to people all the time, personally and professionally, who are experiencing this in some way. That was why Elise started, and I think somebody put in the chat that they have to be careful of triggers because this is very prevalent, unfortunately, for a variety of reasons. But so in terms of prevalence, approximately 6%. This was in a more recent study that just came out, and we have this in our references at the end. report being estranged from their mothers, while 26% report estrangement from their fathers. So it's much more prevalent with fathers than mothers for various reasons that we'll get into. Women are 22% more likely to experience estrangement from their fathers compared to men. So women are much more vulnerable, and it's more common with that. LGBTQ individuals are likely to be estranged from their fathers than non-LGBTQ individuals. So that's a big dynamic that we'll have a little bit more emphasis and focus on. Elise will go over. And then here's some statistics that you can look at. You will get a copy of this. But if you just sort of go down this thing, you can see that, and this is from, I'm forgetting the year this was published. This was in the last 5 years, I believe. But so if you look here, that by gender, it's much less common for a man to be estranged from his mother than his father. And so 24% of men are estranged from their father versus 27% by a woman is estranged from their father, but they're much lower percentages with mothers. So 6% and 5% for mothers. But if we look at race, we can see that 7% of white Caucasian people are estranged versus, Black, Latina, and other multiracial. It's very low. But then when we look at fathers here, we see much higher percentages amongst every racial category when it comes to fathers, with Black Americans being the most estranged from fathers, almost 50% are. So this is like a big crisis in terms of relationships and families and staying together and the strength of that in culture. In terms of sexuality, we see the differences here where, again, there are lower percentages of all different sexual orientations being estranged from mothers, but when it comes to fathers, it's much, much higher over here. So this is something that we need to be aware of and, bringing that into our work and understanding clinically.
Yeah, and I think also, Stephanie, the way you were saying, so we could look at parental estrangement as a problem, or we could look at parental estrangement as a solution potentially. And I think you're going to see both sides of it. And I think we always have to be aware of societal norms that we all grew up with and that we all learned about, as far as having the nuclear family and what does that look like. We all stay together, and what's depicted on TV, excuse me, about holidays and family being together and getting together and watching friends on social media get together with their families. And it doesn't always look like that. And even though it would, we have this, we're brought up with this vision of what a family should look like. I think as therapists, thinking outside of the box of what does your family look like and making that okay and understanding the dynamics that play on, our right wrong theory and what should be and shouldn't be, combining our own experiences with the client's experiences. So we're gonna add on all of that, but I guess my point being is that sometimes it's necessary, and for the health of the people who are involved.
Right. And we're going to also talk, that's going to lead us into countertransference issues, because we all come with our own experiences and values and worldviews, and and we all sort of maybe have underlying feelings and wants and hopes and dreams for our clients, and we have to figure out, how to keep that really checked so that we're really truly helping somebody on their own personal journey with this. So anyway, here's some other research that we just wanted to do to set the context and the stage for some of this. In 2015, there was university students that measured communication between family members for more than 30 days. It found that 8% of students had no contact with their fathers, while 1% had no contact with their mothers. So again, in this survey, it was, fairly significant, but not as significant with mothers as with fathers. The same study found that 6% of respondents reported an estrangement from their mother, while 26 reported an estrangement from their father. The average age at estrangement was 26 years of age for an estrangement with a mother and 23 years of age for an estrangement with a father. So these are critical, vulnerable years that we're working with young adults and people in their 20s, that we're really helping them to shape them and to understand how this could really play out in the years ahead. So we need to be aware of that. And in 2018, there was a sampling that 20% of this age group lacked contact with a father figure due to estrangement, death, divorce, incarceration, and/or the respondent never had or does not see that person as a father figure to begin with. So this is a whole other cultural issue about fathers' involvement and place in things. And I do a lot of court-ordered co-parenting counseling, and I am very aware of understanding the importance of these dynamics so that when I can help people sort of at the very early stages of divorce to stay connected as co-parents so that parents, to maybe hopefully prevent some of this from happening as they go into their 20s. Okay. So this is just another, graph. It was a nice visual we found that just helped people see what age does estrangement typically begin. And you can see that the greatest time that it happens is 25 to 34, but that it's really starting to happen also in younger years up before the age of 18. This is usually due to a parental influence, divorce, addiction, mental illness, incarceration. Then we go into these years, which tend to be really pivotal years in terms of when those relationships get solidified and problems start to really emerge and be identified. This is the key area of when, estrangement really can settle in. And if those issues aren't resolved, or there's children and adult children in particular don't feel that they're healthy, good relationships for them, they start to make those choices. And then it gets, of course, once you get through these sort of higher risk years of things not going well, it's still kind of typical and common here, but it really becomes atypical once you get above 45 years old, that you generally are going to not be as, there's not as much of a risk of estrangement. Okay, Elise.
Yep, I'm on. Okay, so I was in my research on this topic, I came across this idea or theory about similarities and differences as contributing factors to this idea of parental estrangement. And so here's just some different articles that actually lend itself to that. The first one being similarity seems to be one of the best predictors of the quality of a parent-adult-child relationship. This was, mind you, right, over 10 years ago. Um, but people are people. So using both between family and within family designs in this study. And so they're saying the more like you are, the more alike children and parents are, the less likely this may happen. The more different they are in their viewpoints or the cooperative piece that there may be more of a separation, which is natural, right? Because sometimes there's clashing. Adult mothers in this next one, adult children whose mothers reported that they were more dissimilar to them were substantially more likely to become estranged than adult children whose mothers reported that they shared a similar outlook on life. Now, remember, this is not the only contributing factor, but if we have what we'll call wonky dynamics to begin with, and then we have this as a piece or an added on piece, could it be what ends up toppling the whole system? Or may people feel that they're not similar because, we're going to get into personality disorder type traits, but is it that I don't align with my parents' views? I don't like who my parent is. I would never be in my parents' life or my child's life if it's on the other side, if they weren't a part of my family. And then does this similarity difference contribute to that? So maybe it's not like you like to bake and I like arts and crafts, but maybe more on values and viewpoints and how we interact with people and how we treat people. And maybe the alignment isn't there with that. So the studies go into more details about what it is. Um, and this last one also is examined estrangement narratives using communication analysis, uncovered value differences. So this is kind of like what I'm saying is it's more of a, right, this inherent issue of we are completely misaligned. I don't like the way you use or treat people. I don't like the way you cancel so easily on your friends. I don't like the way you're not present when I talk to you. And so that's more of the similarity and difference. Okay, so this for the LGBT community, when acceptance, when awareness, acceptance, rejection comes in, sometimes it creates a problem as well. So here's just some stats, and I'm going to go a little bit deeper into the LGBTQ plus information. But LGBTQ plus adult children are likely to experience a heightened risk of estrangement with parents compared to heterosexual. This is all from this one study in 2023. Um, a child's sexual minority identity has been shown to be associated with negative interactions, lower solidarity, and less contact with parents, especially fathers, who are more likely to have homophobic reactions than mothers do. And LGBTQ plus people appear to have fewer family contacts and confidence than heterosexuals, mostly due to this rejective type of climate that parents sometimes create. Um, and they seem to get more support from friends as more consistently, and so they consider sometimes a family that they've connected with and made up different than their family of origin. LGBTQ plus individuals have greater geographic distance from parents relative to other sexual identity groups, so less suggesting less secure ties, but also sometimes that distance provides the space between the child and the adult child and the family without having to estrange, because it's not every Sunday dinner, because it's not shopping together, because it's not helping out with things. It's more we can handle and we could manage these issues for short periods of time when we get together. So sometimes that distance provides for that. Okay, so let's now move into a little bit of just more specifics about LGBTQ and parental estrangement. Identity rejection is sometimes a phenomenon that happens where estrangement can occur when parents reject or invalidate a child's sexual orientation or gender identity. And it could create some long-term impact um, for the person that's being rejected, relating to self-worth, trust in relationships. And we're going to get into the clinical pieces in a bit. But a little example of this might be Alex, who's 28 years old, was told by his parents that he was going against God after coming out as gay. They completely cut off support, leaving him grieving, and left kind of without a family and his cultural community. Um, Conditional acceptance. So, what does that look like? Sometimes parents may maintain contact only if the adult child downplays or hides their identity. So if you come over and you dress like a man instead of a woman, you could come over. But when you come over dressed like a woman, I'm not okay with that. Might be something like that. So, for an example, if we have Maria, a trans woman, is welcome at family gatherings, as I've just said, if she doesn't dress in affirming ways. And so, not okay for her, feeling erased, feeling like she's not accepted for who she is. A chosen family. So, as we've said, many LGBTQ plus adults replace the estranged family or the family that they're not really feeling connected to anymore with a supportive chosen family. So we may have, for this example, Jordan, who's 40, non-binary, is supported by friends during the holidays. Um, but still would like to be a part of that family's life, and also feel sadness about it. There also might be a heightened risk of harm, where reconnection attempts may re-traumatize if parents remain discriminatory or manipulative. So, what that might look like also is Sam, who's a lesbian, 32 years old, considers reconnecting with her mother, who previously demanded she end her relationship as a condition of acceptance. So, and then what does that do to the person if I, am now having to choose between my parent or myself and my partner? So how do we work? Like, what do we do as far as clinically? And so I thought it would be more pertinent rather than saving this piece to the end where we talk more about clinical issues, to kind of just grab it right here because sometimes it's just very specific. Um, we might want to kind of work with the client to explore their lived experience and how this rejection or how it's feeling, because we know it can disrupt self-worth, belonging, sense of identity. um, and so we want to explore both the clients like emotional and relational wellness with these situations of, how are you doing, and then how is the disconnect from the family impacting you? Where do we get our support from now? We want to explore, is there a chosen family, and the role that they do play in the person's life. So you really want to understand who they are and who are the players and what is the dynamics that this person has or created, or have they not? And are they feeling like they're floating out there all alone and you're the only person in the world? And sometimes you are that as the therapist that they connect with and that gets them. I have, many of our clients, patients, and I'm sure you're the same, have told me, you know me the best out of anybody in my whole entire life. I tell you things that I don't tell anybody. I feel safe and seen with you, right? And so we become sometimes that extended family for our clients. We want to explore also if there's trauma
Wait,
responses.
Elise,
Yeah.
I'm so sorry to interrupt you, but I think that one of the things that you're saying is so important. And I think a thing that our clients might not be able to verbalize, but I think is a big winds up being a big role of ours is this idea of sort of wiring attachments and reparenting people. And so, we can become, you know, a very significant attachment in a way that people feel really safe and taken care of in a way that they might not have felt when they were growing up. And so that also can play a part in this, unfortunately. The sort of contrast becomes clear with their own family sometimes.
Thank you. Yeah, it is. And remember, yes, and it's just so important to recognize that and the role that we play and that we really work on ourselves, and we're going to get into that when we talk about the countertransference and the clinical issues, but the role that we play in our clients' lives and how important it is to do our own work and work on our own stuff so that we could be our best selves for our clients. Um, Want to help them work on any internalized shame and societal stigma in therapy, and also support boundary setting without framing reconciliation as the default healthy outcome. So we want to make sure that we're not pushing or guiding them towards any outcome or resolution of the family dynamic that this person finds themselves in. So we really want to just promote like this safety well-being, and that it's more important than the reconciliation itself. Um, and that sometimes we should validate or help to validate that estrangement can, as I've mentioned before, be the healthiest choice for somebody. Even though that's it's just hard to conceptualize. Okay, so Stephanie, I think you're up here.
Yeah, thank you. So now we wanted to talk about there's, a big impact about our culture and our society and how this can be happen and be affected. And different cultures are going to be more maybe prone or less prone to these dynamics. So we just wanted to talk to you about some of the changing social norms and some of the things that are, relevant to think about when we think about what can lead to this in the more bigger picture. Um, on the more meta level. So, individualism versus collectivism. So, in more individualistic societies or cultures, there is a stronger emphasis on personal boundaries, mental health, and self fulfillment. Adult children may feel more empowered to distance themselves from toxic family members. So that's a big thing. Now, one of the things is we can look at things in terms of American sort of norms and cultures that really can attribute to this. But we also have to remember that our clients come from so many backgrounds, so many ethnicities, so many different, countries and languages and cultures and ideas, which can be very integrated or not. And so we might think that America is very individualistic oriented, but then we might have clients that come from different, backgrounds and cultures that are more collective oriented. So we have to be aware of the fact that some of these will play a big part in their making their decision and working with you and feeling really torn and conflicted and uncertain about how to navigate this. There's family loyalty expectations. In more collectivist cultures, family loyalty and duty often discourage it, even in conflict, and even in cases of conflict or abuse. I work with immigrants from South America who are very, very against estrangement. And even if they tell me about these horrible stories of abuse growing up, they still feel very motivated and very determined to make the relationships with their parents better as they become adults. I've also had the opportunity to travel to Asia, and I've seen that in Asian cultures, it's really discouraged as well, as just two examples. We also have to understand the evolving family structures. We have a pretty high rate of divorce in our society, and remarriage can lead to parental alienation, loyalty conflicts, blended family concerns, all different ways that people can feel resentful and alienated and uncomfortable and unsafe in their new family. And they feel like they're losing a parent, or their parent has divided loyalties now, or isn't making them sort of the center of their, you know, object of their love and all of their affection. And that can feel very painful and difficult. And then, as Elise said, she went over the LGBTQ plus whole, dynamic of how that can really lead to family rejection or, lack of acceptance and lack of understanding about who they are and what they need from their families. Other norms that we wanted you to be aware of are the mental health awareness and therapy. There is, a lot more awareness, research, podcasts, information online on AI and Google about there's a much greater increased awareness of trauma in our lives, our trauma on our neurodevelopment, on our neuroplasticity, on our neurology. We're much more attuned now to narcissistic abuse. There's huge upticks in narcissism in our society that can lead to this. We're a lot more aware now, and we as therapists are getting trained in helping people to deal with emotional well-being and how to handle harmful family members. There's also a lot of online communities and mental health professionals that provide validation and support for estrangement, which does ultimately make it more socially acceptable. And that's just something that we all, again, have to be very aware of when it comes to countertransference and our role in their lives. But, a lot of times we do find ourselves supporting and validating a client who's been horribly mistreated or so anxious and stressed by their family and how they treat them. Um, but there sometimes can be a middle ground and a way to navigate it, and sometimes there can't be. Generational and political differences are huge now, as we all know, that can create political polarization, anger, generational shifts in values that can lead to family conflicts that become severe enough to cause estrangement. I have a client, she has 4 children, and 2 of her children identify as liberal, 2 identify as conservatives, and they just can't get together anymore as a whole group. And the 2 of us talk about how sad this is for her and how she can navigate it, but they all digging their heels in and don't want to get together and be close because of these differences. And that's another whole issue that can happen in addition to this kind of estrangement. And then older generations may view estrangement as an act of disrespect, while younger generations can see it as a way to take care of themselves. So this is something to be aware of as well. Also, there's the financial dependence issues. In cultures where adult children rely on parents for financial support, estrangement may be less common or, of course, more complicated. We're seeing more and more younger adults who are needing to live at home and needing to still be dependent on their parents. And how does that play a role in how they're going to handle some of these emotional issues that aren't healthy and good for them? That's a huge part of this issue. And we also need to understand elder care expectations. How do adult children care for aging parents? Even if I have a client, her mother has always made her feel that she favored her brother over her. Her brother passed away. She's the only person around now to take care of her mother. And even though she wants to, and it's incredibly important for her to be there for her mother, she still has enormous pain and hurt about how she felt like she was treated growing up, in terms of her mother feeling like she felt so strongly that her mother loved her brother so much more than her. So, and and always wonders if her mother wishes her brother was still alive and not her. So there's a lot of stuff here that I'm sure people have seen or dealt with that really gets played out here. Okay.
Okay. So let's just kind of look a little bit about the path to parental estrangement, because it's typically more of a process than a single event, and it doesn't really happen overnight, at least from my clinical understanding of it and the research. And instead, it's often the result of this long-standing pattern of conflict, of unmet emotional needs, possibly boundary violations, unresolved trauma, and typically the decision to cut contact, or gradually withdraw. It typically evolves over many years, which is influenced by specific life stages and experience, which we'll talk about in just a moment. Um, so it's usually something that happens that kind of builds and grows. And I think on this next slide, here we go. We're gonna just talk a little bit. So here are some triggers. Life events, situations that may happen.
Lisa, I'm so sorry to interrupt you, but
Go ahead.
somebody put in the chat, which I thought might be timely,
Go
that
ahead.
the change of the definition of abuse has changed over the years. So if you could maybe incorporate what your thoughts are about abuse and how you're defining it too, as you talk about these things.
Sure, sure, as it comes up. So, but I think if you could hold that thought for a moment, because everybody's definition of what I guess we're calling abuse might be different, and different in severity and subtlety. because somebody might just not be able to live with a situation that feels hard. So then do we define it as abuse? Or is it a life circumstance that they're not comfortable with anymore, or they've never been comfortable with, and now they're feeling like they want to move away from it? So I think before we start throwing around the terms of abuse, um, I think we could see how it relates to parental estrangement or does not relate to parental estrangement. So let's just kind of keep moving on, but I appreciate that. And if you don't feel settled with it, either towards the middle or the end, give me a specific question that we could kind of look at. Okay, so let's just pop back to this slide regarding triggers, which are life events or situations. And as I've mentioned already, they could be subtle in of a shift of interaction and closeness with an adult child. And typically what we find is the shift is more in intensity than the development of a new issue happening. So it's more, it feels worse for me, or the situation has grown and expanded and kind of increased in tensions. So it's typically not a new issue that causes estrangement. It's typically something that grows and develops. So just looking at this as a little example, a mother's statement when Rachel, a mother of four, described her relationship with her youngest daughter. She said that she had to choose her words carefully with Lisa and described her as loud and quick to get angry. And so the daughter would say, "My mom is so critical. She's always blaming me for my children's behavior." So she's blaming her for the grandchildren's behavior. Also see the way she looks at me because I've gained a few pounds. I hate it that my children witness the disrespect she shows me. Now my kids are repeating some of the same comments. So we're seeing this gradual expansion of challenges that this daughter is having with the mother, and an increased awareness that she's just saying, I can't do it anymore. So here she says, I know I will have a breaking point and I think it's coming soon. I struggle because how do I take care of how do I take my children away from their grandparents? So we have now the issue of guilt popping up, the issue of right or wrong. What do I do? She's saying, Kira, if it was just me, I would never see her again. I grew up with this intrusive and highly critical behavior my whole life. So we're hearing like this, do I stay or do I go? And sometimes as we see, this is something that this adult child has lived with her whole life. She doesn't like her mom. She doesn't like the critical, and we're assuming she's potentially tried to address this with her. Mom, stop talking to me like that. Please stop saying that. Stop doing this in front of the kids. Sometimes parents do or don't, and then the adult child says, I can't do this anymore. I can't take it. And then sometimes we see a gradual disconnect of, okay, she texted me, I'm not going to answer. She called me, I'm not going to pick up the phone. So sometimes it's not a complete off with your head, I'm done with you. It's a boundary setting and pulling back. So we start to see the growth of this estrangement happen. And hopefully that kind of depicted a little bit more of what can happen. Um, so let's now kind of look at this, like, I guess if we think about ages and stages and what we see, because you all may work with little ones all the way up through. You may work with parents on parenting issues. So no matter where you're at in the process and where you're grabbing it, it's important to understand this foundation that may have led to it, because you may be grabbing it at different parts depending upon the population that you work with. And or if you're working with an adult, who is that this is one of the impacting factors, you can kind of, no matter what type of therapy you do, kind of understand some of the dynamics of where it comes from. So let's just take a look at them here. 0 to 12 years. I know that's like a huge time, but it is formative years where a child is really pretty completely dependent on a parent for most, especially in the beginning stages, if everything to most things. So issues that may lead to it, and Stephanie talked about it a little bit before when we're talking about attachment theory, connection. How does a parent and a child connect? Are they there for me? Is a child having to take care of their own needs because the parent isn't emotionally available? Is there lovey, huggy, kissy, love you, love you, love you? Is it too much? Is it not enough? Is it not there at all? Is it, you should have tried harder with this validation piece. I know you could have gotten an A. Why did you get a B? Why does the cotton on your sheep's tail go there? It should go there, in kindergarten. Why does your son have a smile? Sons don't have smiles. So what are the messages that the child has received, both the overt messages, the outward messages, the verbal messages, and the ones that are withheld? Is there inconsistent or neglectful parenting? Are parents overly authoritarian or controlling? As Stephanie kind of spoke to a little bit before in one of the stats, favoritism among siblings, splitting and dividing if we have potential personality disorders. And I'm gonna, like, I guess, kind of put that in there a lot. So remember, we can never diagnose somebody we're not working with. So we can say we see traits of, we see personality disorder type traits, or this might be a narcissistic trait, but we also don't want to lead a client down a rabbit hole. But for us, we want to be aware of what was going on, especially if there's a splitting and dividing of siblings. Hey, that's a little bit of a red flag for us as a therapist to understand, why would a parent pin children against each other? Um, what's going on there? So was there also exposure to high conflict family dynamics such as divorce, parental alienation, which we're going to talk about a little bit more? Um, and these early attachment wounds could, as we kind of know, manifest, later on, and impact a child's sense of safety and ability to connect with people. And this lays the groundwork also for future relationships. So we know the impact of this not being on target, um, for a lot of people because we see it if we work with them as adults. So now we move into this adolescent, 13 to 18 years old, where we have this identity formation, independence. We're starting to step out, figure out who we are, separate and apart from who our parents are. So excessive criticism. Why are you wearing that shirt? You can't wear that to school. Parents are supportive and guide, but then when it becomes excessive or criticism, you've gained weight. Why is your hair looking like that? Why? Instead of, the guidance and support, um, for who they are, while still helping to guide them with decision making and awareness of things. Controlling behavior that might stifle their autonomy may be there as well. There may be a conflict over values, as we've discussed, gender identity, lifestyle choices. Um, so this may kind of, these are the years where children start to, right, this separation and individuation. We start to become human beings at this stage, and our own likes and dislikes. And if those are not fostered and massaged in the right way by parents, sometimes there could be issues that my parents don't get me, they don't see me, they don't love me, they hate everything I do, they're always critical, may cause somebody to completely conform because they don't want to deal with the conflict or the pull or force of consequences, may lead them to conform even when they don't really want to, or may lead them to rebel or anything in between. But then we look at it of where we took that example before and we heard my parent has been critical of me my entire life. Right. So what does that tell us? There was an issue here, and we want to kind of understand what may have led to it. Not that we're saying it's not a good choice to estrange yourself and separate, but we want to just help that person to become, I guess, less activated around what happened in childhood and all the criticism, because it not only impacts parental estrangement issues, which that's a separate choice, but it also may impact how they see themselves, how they move forward in life, how they relate to their own families, friends, and all of that. The parents may reject the rebellion, this separation, this learning how to be your own self. Um, and an adolescent may feel unheard or controlled, and this is where this emotional distancing may start, setting the stage for the future estrangement. We have now this 18 to 30 years old. So if we think about it, we're off to college potentially, or potentially moving out of the house, finding a partner or partners, maybe having kids, maybe starting our own families. So this is kind of that stage. And if we think about that graph that Stephanie showed before, the age where it starts, and we find that during this stage is where often this estrangement begins. I now can be independent, make my own choices, sign my own documents, make my own money. I don't need you. I'm figuring out who I am separate and apart from this family. So they start to feel more confident and creates distance between the dependency on parents and their own individualization and in being independent and being able to move forward. Sometimes during these years too, that when you take on a partner, sometimes the partner or the friends may cause the adult child to see things in a different way. Why does your mom always say that to you? Why does your parent always say that to you? That's not okay. And now the adult child is now with their partner talking about, I hate it when my mom does this to me. So they may be able to see things and understand things through somebody else's eyes in a different way. They may start to have children themselves. And now, right, I never want to be like my parents. I never want to parent like my parent, especially if there was faulty parenting and you come out of your childhood feeling off. Um, Making different choices with your own child may also lead somebody to feel like I need to move away and take care and protect myself. And now we have this middle adulthood stage where, as this continued parenting of their own children sometimes brings up unresolved trauma. I'm working, I know, with a person right now who, she's so afraid of becoming like her mom and doing what her mom did to her, to her own child. And she has now not completely estranged, but has worked on separating herself, not responding to text so often. If she responds, making it kind of flat and a one line so as to not excite anything going on, to understand things. And because there's so much confusion, I find, for people. especially when you've grown up with really wonky, I'll call them, family dynamics of, but I'm supposed to love my mom and this is supposed to be okay. And I'm not supposed to feel like this, but I do. And it's this coming to some sort of an awareness for them to help them to understand their own family dynamics. So, this deepening commitment to boundaries, as we've talked about, and this frustration with ongoing parental behaviors, this guilt tripping. If you loved me, why do you do this to me? Um, you always do that. You always stayed in your room. Now you're just not coming over for the holidays. So this trying to make somebody feel bad and this inability to rebuild trust due to this like repeated patterns of just uncomfortable dynamics. So by this stage, adult children are less likely to reconcile unless some meaningful changes can occur in the relationship. And when I say relationship, because if we are working with the adult child and the parent is not getting help as well, and then we're not potentially having some co-work done, sometimes they may grow at different levels and in different directions, I find. Um, and then we have later adulthood issues, some reflection and regret time. Parents may feel entitled to reconciliation without addressing past harm. It's like, are you done with this yet? When are you going to call me? I'm getting older. I'm not going to be around for long. You're going to regret it when I'm gone. And so sometimes any attempts at reconnection may feel this like insincere, it may feel insincere and guilt driven more because it's like this, I feel like I have to, and that by not doing it makes me feel bad or like I'm doing something wrong. But how do I take care of myself and take care of the situation at the same time? Sometimes aging health concerns may prompt this like last minute effort to reconnect of my parent is getting ill, my parent is a chronic condition, who's going to take care of them now? But I can't stand them and they still are critical every time I walk in. Oh, Betty, yeah, you've gained a couple of pounds, haven't you? Walking, as a child walks in with bags of groceries, like, here, mom, how can I help you? Let me put everything away. It's like, Betty, you've gained weight. It's like, oh my gosh, there it is again. And how does the adult child, manage and deal with this? There's never a right answer. There's sometimes just an answer that feels better. And for everybody, remember it's different. There's not a way through this. There is the right way for that person to move through it. That sometimes doesn't feel right. So without this mutual healing, estrangement may remain somewhat permanent at this stage. If they do get back involved, sometimes I find that it's like an emotional cutoff and they're able to boundary the emotional piece and still engage functionally with somebody. So there's all different levels of it. So this clinical understanding of the cycle, early intervention in these strained relationships can sometimes prevent long-term estrangement, sometimes not. And also, as we've said, it's really important to understand the age-specific triggers, even if you're not working towards reconciliation, just helping the person, as I call it, it's not even heal, but to be their best selves. I always say it's more about being better tomorrow than you are today, whatever that means. And sometimes it's an understanding, not necessarily a shift in behavior or dynamics. Okay, so now what we're going to move into, and remember, we're going to kind of talk about this, what we've covered all the way through. Issues in managing disclosure. So talking to people about it. And this is sometimes hard. It's embarrassing. You're not included all the time. Many people have friends that talk about spending time with the family, or, oh my gosh, I need to call my mom. She's the only one who can help me with a problem. Or I love my dad. I can't wait till he comes to visit. And then the person who is estranged or has needed to set boundaries, how do they talk about their life with somebody who has more of an intact life? What is the shame, the social stigma? So sometimes, if we share with friends or families, we're afraid of judgment, or gossip. Are people going to talk about me? Oh my gosh, did you hear about? Or how does she do it? Not talk to her mom. I don't know what I would do without speaking to my mom. We want to help people to understand that people can talk, but who might be safe to talk to? Who do they feel comfortable sharing with or not? Um, like sometimes helping them script some boundaries. I call them, just like some statements to say. Um, that they could choose how much they want to share and with whom. It doesn't, sometimes people have trouble with boundaries, especially if they've come from dynamics where the boundaries are wonky, and sometimes feel like they need to, people feel like they need to share everything, and helping them understand that it's okay not to do that. I call, sometimes when you need to make something up because you're not comfortable sharing, call it what? A therapeutic lie or a therapeutic information sharing. It's your choice of what you share, and it's okay of how you slant it or twist it because it's yours. We're not doing something purposely to hurt somebody. We're doing something that feels better for you. Shame, sometimes there's a lot of shame and this confusion or guilt of what you should be doing or what a family dynamic should look like. So many times people feel internalized shame, feeling like they've failed as a son or a daughter or a parent, um, and feeling like if they tell somebody that people are going to see them as having something wrong with them. Right? When somebody says, "Oh, I don't talk to my parents anymore." If I was to say that to you, I don't talk to my dad, what happens in our minds? We automatically make up a story of what we envision that looking like. And so it's important to understand what happens for real with people so that we can help them work through this. Sometimes with a societal stigma, there's just a strong cultural expectation, as Stephanie has alluded to like honor your parents and in different cultures, to keep family ties at all costs. Elders are always right, kind of thing. Also, with judgment and assumption of blame or fault, the listeners, as we said, they make up their own story and they may assume that the estranged child is at fault or that reconciliation is always the goal. Oh, you know what, everybody will get over this and you'll all talk soon. Um, Contraindications of expectations of what a family life, because they may feel pressure when others assume close family ties during the holidays, as we've talked about. Weddings, how do we show up at weddings or different milestones? And then there may be a lack of understanding or capacity to understand, from people, that they're just not able to conceptualize it, and understand why it happens. Sometimes it's fear of something happening in their own life, or, um, just maybe they have issues themselves that they're not willing to address, or maybe they just don't get it. It's okay. So it's important for us to help our clients through that. Let's see. Okay. So here we're going to go through, there's different levels of estrangement. And so this is important as well. So what does it look like in families? So we have this complete estrangement. And so what is complete estrangement? This is like no contact with one or both parents, sometimes with extended family as well, because you may need to cut off brothers and sisters, aunts and uncles, parents, you may have to block them on phones, social media. Um, and it can last for weeks, days, months, years, forever. I don't know. Don't have to make any decisions on that. It could just be a for right now thing, but just so we know, it can go on forever or a long time. The parents sometimes may experience grief, confusion, loss, while the adult child may feel relief, sadness, anxiety, guilt. So remember, we're only working with one side of it. Sometimes we are working with the parents, sometimes we are working with the children. Sometimes we're working with an aunt or uncle or a cousin or a brother and sister. Sometimes, just so you know, this may be the primary reason somebody has come to you for. And sometimes it may be a secondary or tertiary reason that, or a tertiary issue that comes up that you didn't even know about in the beginning. It's, you just talking, what is your family life like? And, oh, I don't talk to my mom. Whoa. Well, like, how long has this been going on for? Where maybe they came to you because they're just having relationship issues with their family, or maybe they're looking for a job change and they just are feeling stuck. And then all of a sudden, this comes up as a secondary issue. So, once again, we're looking at here the levels of it. So, this complete estrangement, an example of it might be like after years of emotional abuse and boundary violations, Rachel has decided to cut off all communication with her father. She changed her phone number, blocked him on all social media, no longer attends family gatherings. While she sometimes feels sadness, she recognizes that she's had to do this for her own mental health. And she feels better and not so good also, that since she's disconnected. The second one here, partial estrangement. So what is that? That's low contact or conditional contact. This is where we have limited interactions to specific times. For example, okay, we'll go for Thanksgiving, and that's it. Or we'll go for some summer break time, and that's it. We'll see each other at weddings, funerals, and one major holiday in a controlled setting where we're not going to be alone, or maybe it's where we are at your house and that's okay. Conversations maybe remain surface level. We don't talk about politics. I don't, if my mom criticizes the way I look, I say, thanks, mom, for the information. We keep things on a surface level to avoid deeper conflicts instead of, mom, what the heck, again? You're going to pull this crap on me again? So we just say, okay, mom, and we walk away and go in the kitchen and help somebody else, right? So ways to kind of keep, so we're going to still be involved, but we're not going to have, I'm not going to talk to you about what's going on in my life. Sometimes it's more restricted to texts, emails rather than in-person visits. Boundaries are enforced, no discussing past conflicts, no criticism of lifestyle choices. Sometimes that's the choice of the adult child. The parent doesn't necessarily comply. So we work with the adult child on how to respond when they bring something up so they can set healthy boundaries. Cyclical estrangement, in and out, this pattern of distancing and reconciliation repeating over time. These triggers can be family gatherings, as we've said, life transitions. So political or personal disagreements. So these could be the triggers, and they may lead to like, oh, I need to cut off again. I'm kind of done with this. I don't want to jump back into it. I see now why I distance myself, because sometimes time heals, or time creates an ability for the regulation to happen again. And then they put themselves back in this situation. And then it's like, whoa, now I feel it again. Whoa, that's why I haven't spoken to them for a month or two. Okay, here we go again. And so this is potentially cyclical estrangement. So just a little example of this. Jacob regularly calls his father and attends family events, but their conversations are superficial. Despite the appearance of connection, Jacob no longer shares his thoughts or feelings with his father due to years of judgment and emotional invalidation. Number four is more selective estrangement. So let's talk about what that looks like, where the child may be estranged from one parent, but maintain relationship with the other or siblings or brother and sister. So estrangement may extend to specific family members, a step parent, grandparents, siblings, and family events may require some navigating some complex relationships, which lead to tensions and choices. So, um, so basically, what this might look like is having so we have here maybe Rachel who speaks to dad, but really can't handle talking to mom anymore. So that Rachel and dad may meet for coffee or may talk on the phone. They may talk on the phone while mom is present. And then mom says, "Oh, is that Rachel?" And Rachel says, "Dad, please don't pass the phone to mom." And sometimes that puts other relationships in the way. So working with your child on working with your client on understanding what that dynamic is and how to navigate it behaviorally and emotionally. And then we have also this silent estrangement where the child maintains a surface level interaction and feels emotionally detached, but they physically are there. So the conversations, once again, may lack depth, and we find that lack of depth of conversation throughout. And the relationship feels distant or obligatory. Okay, they want to see the grandkids. I'm going to drop them off, but I don't want to keep my mother from my child, but I'm not going to hang out. So I'm going to give her my daughter and I'm going to leave and go do some errands and then I'll come back, pick her up. She wants me to stay for dinner, but I'm going to let her know I can't. We're not going to talk about anything. So there may be some passive avoidance, really initiating contact, or keeping visits short or very boundaried. Okay. We have this also, a couple of more, this forced or involuntary estrangement, where one parent may manipulate the child into estranging from the other parent. Parental alienation. And Stephanie, I think we're going to talk about that a little bit later, but Stephanie and I have both um, worked with families where this happens, where it gets really wonky really fast. It confuses the child as to like what is or is not happening. So we may have a parent who calls an abuse hotline and says, "I think that my husband is sexually abusing my child," while they're in the throes of divorce, and or things saying things like, I to a child like, "I would never do that to you. I would never make you do your homework right when you come home from school." So a parent may be manipulating a child into separating from a parent, and then we see the result of it later. I had a client I worked with whose husband and then ex-husband um, manipulated their child to not see the parent, so much so that the court agreed with the father. The adult that I was working with was in her 70s and didn't see her child, I would say, for about 35 years, 35 to 40 years. We worked on that. They actually, in our work together, ended up reconnecting. It was a little wonky in the beginning, but she did actually make contact. She was so afraid to. And it ended up working well. So we see sometimes the effect of parental estrangement later on. And so sometimes we could help to provide that adaptive knowledge and educate as to what may have happened, because the parent then may believe that they actually did something wrong when they didn't. Um, or the other side of it, maybe they did, but how do you move on from it? There may also be cultural or religious expectations that may force a child to distance themselves from a parent who does not conform to family norms. And the adult child also may not want full estrangement, but feels the pressure from a spouse, or extended family or community. So sometimes we see this when we see personality disorder traits in the adult child's spouse that says you need to basically choose between me and your mom, and puts parameters in place to kind of enforce that. So that may not be a verbal statement, but it is a underlying statement of why we can't let your mother come over for that long. What's wrong with her? And so sometimes we find the spouse is the one that may put these forced expectations in place. And then we have this family reactions to estrangement. Sometimes parents may experience grief or denial or anger or confusion. So if we're estranged from a brother or sister, other family members may get involved. So, what are the reactions and who is your client? And understanding the dynamics and how it impacts them is helpful. Okay. Stephanie, I think this is yours.
Yes, yes. So thank you. Yeah, so I do also want to say that we are planning on, as Alex had shared at the beginning of our presentation, we are planning on providing a 15-minute break, almost exactly half through. So around noon, we will be taking a break. So in another like half hour or so, we will be doing our midday break, just so everybody's aware of when that'll happen. So anyway, we did want to talk about, again, these are some other family dynamics that lead to parental estrangement, the abuse, which again can be on a continuum and can be a little subjective sometimes, but maybe not. In terms of, is it overt or covert? Sometimes it's absolute like emotional manipulation. And we actually do a presentation on parental alienation, and we talk about some examples of just covert ways that one parent is influencing the child negatively against the other with very small and very like subliminal or very, small ways in which they try to say negative things about the parent that you almost so subtle that you wouldn't even notice it until you see how it builds up and it creates that loyalty and feeling of a child feels like they need to align with one parent over the other, or that they start to have really negative perceptions that are hard to change over time. But anyway, physical, verbal, or emotional abuse is a huge factor, as we can imagine, where it is really important that that adult children take care of themselves, even if the parents have gotten help and have shifted and changed. Sometimes it's still not enough, and sometimes it is. We also want to understand parents who have, and we're going to do a whole section on on personality disorders, but here narcissistic or controlling parents make children and dismiss their child's emotions. They require constant validation from their kids. They're always looking, they're not able to take in feedback. They get hurt easily if their kids say anything to them about things that don't work for them or don't meet their needs. They just sort of, go to a place of feeling sorry for themselves or hurt or not willing to take accountability or not willing to understand what their child needs from them and make those shifts. Also, again, the unresolved conflict and hostility when there's specific, persistent arguments that just don't get resolved, that go over and over and over again. There's criticism, lack of emotional safety. Sometimes adult children feel like there's no other option. And again, this can go either way. And somebody wrote that in the chat. Sometimes parents can experience this with kids and need to pull away and set those boundaries and, kind of work on estranging from their children because of this. Again, something about, Lise talked about this, unmet emotional needs. When a parent is unable or unwilling to provide the emotional support, a child may eventually give up. The favoritism is a huge issue, and how parents, play into that or not, how they manipulate the situation, how they might feel threatened by siblings being too close, not close enough with them, can be a huge issue and really can set the stage for kids finally saying, I can't handle this level of tension and distress. Divorce is a huge issue, as we shared. And again, because of loyalty conflicts, feeling like parents can pull away emotionally and not be as, focused and caring for their child anymore, picking sides, picking their new partners, their new stepchildren over their own biological children can feel extremely painful. Or there can just be dynamics that lead a child to feel really pushed away and not included. I have a client where her parents divorced. She has a stepsister. She's in her late 20s. Her stepsister's around her age, has a boyfriend who she really doesn't like. And he creates a lot of tension and drama in the family when he comes to visit. And she can't get her biological mom to validate or understand her experience. And it's putting a lot of tension and stress in their relationship because she's experiencing all these feelings that her mother is unwilling to look at or acknowledge because it's too painful for the mother to acknowledge that. And then she knows that it'll get in the middle of her own new marriage. So, these are all issues that just can play, unfortunately, a big part in these problems. So, we've also talked about this already, so I think we're going to keep going. Okay, so mental health and addiction issues are huge. We hadn't gotten to that yet. I know that people bring this up in the chat and in question and answer time. I mean, addiction, obviously, that's untreated or that was untreated for a long time and had terribly difficult ramifications and consequences is huge. It can lead to, all kinds of neglect, abuse, mistreatment, sadness, unpredictability. We know that adult children of alcoholics in particular have very, very difficult and traumatic backgrounds that make it hard for them to have strong and healthy attachments in their, future relationships, intimate relationships. We know that untreated mental illness or mental illness that's unable to be treated or is not stable can have huge ramifications on kids and adult children. I do a lot of work with helping adult children who have dealt with a mother with a borderline personality disorder. In particular, how do they navigate that and work on it and set boundaries and understand it and not take it so personally and understand how to, how to put together everything they had to deal with because of it. Um, and again, it can sometimes lead to the need for estrangement because of it. And then generational trauma is a huge issue too. Unresolved trauma passed down through generations can create cycles of dysfunction, enmeshment, and some children, cling to their parents and aren't able to individuate and differentiate and move forward in their own lives and commit to new partners and new families because they're so petrified of feeling like they're betraying or abandoning their parents. And others need to completely break away to heal and to have good and healthy lives for each other, for themselves. Other things we've talked about was marriage and new relationships. Becoming a parent is a huge issue, as we know. Adult children often reassess their own upbringing. They really look to, I think we can all relate to this as if we are parents, that we looked at what our parents did that worked, that didn't. Sometimes it brings up feelings of more sympathy and empathy. I was talking to a friend of mine. She's one of 6 kids, and we just can't imagine what her mother dealt with in terms of having to raise 6 children and how hard that must have been. But sometimes it brings up a lot of pain and hurt that our parents did things that really felt counter-indicative to what we needed or what we would do as parents. And that brings up enormous amount of hurt and feelings of sadness and needing to, really reassess and pull away sometimes. And another big dynamic we have in our country, in our world, is this idea of creating, moving for careers or relocating in our country. We can move to different states without having, to go through, major types of structural changes. We're allowed to move freely between states and move distances. And sometimes we do that because it's truly the best for our career and for our new relationship or for the people, the way we've kind of set up our lives. In other ways, it can be a way to kind of manage and cope with the stresses of difficult families. And it could be a really good solution for some people to have that built-in space where they don't necessarily have to deal with all of the difficulties that come with seeing their families in a very regular and daily way.
Stephanie, I just wanted to add, somebody had put in the chat something that kind of made me think about, there's like another side to this too, which we're going to get to. Sometimes the adult child leaves because they are the one who is more unhealthy in the relationship. And then we talked a little bit about parent confusion of what happened and what did they do wrong. And I hear some struggles from our group here because sometimes it's not about how the parent parented or challenges in um, throughout, their throughout the child's upbringing. And maybe it was more on the functional side, but sometimes the adult child may have some mental health issues that causes them to need to separate, having some, maybe couching it in that the parent was a bad parent or didn't meet their needs, and we're going to validate that. But maybe sometimes we see more of the dysfunction on the child side than the parent side. So and not that we're placing blame, we're always understanding what has been put in place. So because I think what we've done so far in our presentation is couched it in more of a dynamic that the parent has created. So I want you to really understand there's another side of it. And there's also a middle that's not, it's hard, and what I'm reading is it's complicated, and it is very complicated. It's maybe not like and drawing a map of saying like it started here and that led to this and this led to that and this led to this. It's more about understanding where, who your client is, what they're coming to you with, and what's going on. I've worked with somebody who clearly has personality, or many clients who clearly have personality disorders because I'm able to diagnose them. But I don't always tell them that. But I'm looking at their pattern of relationships in their life and what they have done and created and how their mind sees the relationship. So I don't work with them necessarily on connecting better, but I work with them on where they're at and how they see things and helping them to be their best selves. So then that naturally that will translate over to how they interact with others. But once again, I'm going to say it again because I know I sometimes say things two or three times, but sometimes it takes somebody a few times to hear it. It's not always the parent's dynamic that creates this. Sometimes the adult children have issues, not necessarily related. It's always related, but not as a result of.
Yeah.
Okay, go ahead, Stephanie.
Yeah. I think that is an important thing because it's going to get to one of the myths that we're going to talk about, which is that it's not always the parents who have done a terrible job. We're just, we are a little bit more focused on the effects of adult children. So that is why it's a little bit more like leaning towards what parents are doing. But we definitely recognize that it can go both ways, as Elise said, and we don't always want to blame the parents. Sorry, my paper just fell here. Sorry. Okay. So, some other dynamics that lead to parental estrangement are helicopter overbearing parenting, parents who struggle to respect their adult child's independence. And, again, these are all on continuums, but I have this case where I'm doing this family therapy with her two adult 20-something-year-old children, and they had a divorce. And the mother just continuously steps in and tells them what to do, pushes giving them advice about everything. Like, they went out on a cruise together, and the one daughter who has food allergies started to order. And every time the daughter ordered, she's 28, the mother, interjected and said, "Wait, why don't you order this? Or why are you ordering that? Or why don't you get this?" And and the mother means well, of course, and in general, they have a good relationship. But I've been trying to explain to her that she will, over time, compromise and possibly sabotage this relationship with her kids if she doesn't make some changes and work on letting them set boundaries with her and following through with them. So there's just all these different ways this can look and kind of get put into place. In terms of guilt and obligation, if a parent expects their child to meet their emotional needs or assumes a role of victimhood, and this can happen, unfortunately. I see this a lot where a parent loses their spouse. So, one of their parents is a widower, and that parent becomes much more needy. They're lonely, they're struggling, they need their child more. And then they put some of this obligation and guilt on their kids to meet those needs or to fill in for their spouse that passed away and or to do things that their spouse did for them. And this can sometimes make a child be so exhausted and so stressed out that they might need to escape from the pressure of that. Family enmeshment is a huge issue that's also related to the helicopter and overbearing parenting sometimes, where it's hard for them to develop their own identity, figure out making their own decisions, being able to pull away and create their own lives because they feel like their families are always pushing them to always be together and there for each other over everyone else. And that can sometimes again backfire and make it very stressful and hard. Okay, so now we're going into personality disorders. Understanding personality disorders and its effect on this. So just to start with, parental estrangement often results from prolonged conflict, as we said, unmet emotional needs, or experiences of emotional, psychological, or physical harm. And personality disorders are one of the main factors that can unfortunately really create instability and angst and stress and confusion and all kinds of very, very deep anxiety and difficult feelings inside that might lead a child to feel like they don't know what else to do but to put in distance and to cut off contact or to really cut off a very strong and healthy relationship with a parent. And we do want to start by saying that personality disorders, just so everybody's on the same page, are characterized by emotional dysregulation, impulsivity, and intense interpersonal conflict. It's usually a pattern of people who struggle across the board with relationships. And they've had problems with their siblings, they've had problems with their spouses, they've had problems with friendships. And again, it gets played out again in how they can parent and be connected to their children. One of the things that's really interesting that I'm seeing over time, and I'm sure people have seen this as well, and I just always have found it fascinating, is that I have a fair amount of clients, not at the moment, but over the years, who have a parent with a personality disorder that has been diagnosed by another professional, not by me. As Elise said, we're not in that position to do that, even though we can share that we see traits or qualities that that parent might possess. But it seems like sometimes these personality disorder parents can make it work with one of their children. They can have an okay or semi-good relationship with one child, but not both, or not, multiple children. And so I feel like that is, a really interesting dynamic. Somebody said this is an issue with boy moms, yeah, and their
Yeah.
daughter-in-law.
And Stephanie, I want to add, not only with their own children, but it's like everybody loves my mom. My mom is so nice and generous with everybody. My mom is helpful. My mom is a therapist. My mom helps people, but I can't stand her. Right?
Mhm.
So,
But my sister or my brother gets along with
right.
or deals with it or can deal with it. And I just see over and over again that that's happens where they don't cut off, they don't like lose a relationship with both kids or several kids, just one they're able to maintain that relationship with better.
Right. But then the question is, right, if we're always curious as therapists, like what is that family dynamic? Is that child where we talk about the alignment? Does that child, so sometimes we know that children who are raised by parents with personality disorders can take on traits or maybe have an understanding of the world through the dynamics of the presentation and the behaviors that present from that parent. So are they more aligned in their thinking? If one parent, takes advantage of people, does the child, that adult child that they're aligned with, also engage in that kind of behavior. But now we have, child A who's like, oh my God, like, how could you two do this? So we think about it not in terms of like, well, they have an absolutely healthy relationship with the other child. Maybe it's what is the dynamic that binds that doesn't bind the other. Sometimes I find with the child who is a more aligned, if there's like a discrepancy between one child is out and the other child isn't, sometimes there's a dependency financially or for child care or something that's binding that causes that child, creates a dynamic for that child to make the relationship work, where the other is maybe more separated and doesn't need the parent, and that the separation feels more right than utilizing the parent for childcare. So, that's why it's important to help to understand the dynamic, and also the impact on our clients if they are the one that is not connected with the parents, of sometimes this what's wrong with me, and this guilt and shame that comes up for them, where my mom could have a relationship with, and what's wrong with me, so furthering attachment issues and feeling like there's something wrong with them, where your client may actually be the healthiest of the bunch. So yeah, it's
Yeah, but I've also seen where I've worked with people where they actually are, the parent is, picking one or is able to maintain with one, and that child is healthy. So,
mhm.
that's a really fascinating thing too.
Yeah, yeah, it could go anyway and always. Okay, let's
Okay,
move on.
so what is the role of personality disorders in estrangement? So, personality disorders, as we know, leads to chronic conflict. So that chronic conflict that doesn't get resolved is what we've been talking about that leads to this. Manipulative or controlling behaviors that violate boundaries, not feeling listened to, understood, asking for needs to be met that are constantly being walked over or violated, having them not have empathy or emotional validation for how you're feeling, telling them how they feel and they dismiss it or say, oh, but your sister or brother doesn't feel that way, or I don't agree with you, or what is your problem, or why would you feel that way? I mean, these are all things that children, start to, adult children start to really be affected by, and they start to get really upset by. Um, Again, unstable family roles. They can't depend on that parent with that personality disorder to act, quote, like a parent or a mother or father, or to have that strength and stability and security in the family system. They have to take, there's role reversals, and they have to, take over. Or I see it. I have a client where her mother has a very serious mental health disorder, a personality disorder that's been diagnosed, and her father has chosen to stay with her mother, but they have a very difficult marriage. They don't spend a lot of time together, but he's always defending her mother, and the kids are all dealing with. Three kids are all dealing with varying ways of feeling hurt and pushed away and manipulated and dismissed. And then it starts to shift alliances, and it starts to shift the way they feel about the dad, who in general has been very supportive and loving and stable for them. So that's also a big part that can get very founded and very confused here. And again, we understand when these dynamics persist, the parent doesn't get help, the parent kind of gets more entrenched in their disordered thinking and behaviors. This can just continue to spiral to a place where it might make the most sense to just pull away completely. And again, it can go both ways if a child has a personality disorder or mental illness. So now we wanted to just sort of talk about borderline personality disorders and narcissistic ones. So when we talk about borderline, we're talking about intense fear of abandonment. These are some of the core features that people struggle with: emotional volatility and impulsivity, and patterns of idealization and devaluation. And so the way it impacts them is they exhibit reactive and unpredictable behaviors. They yell, they scream, they call them names, can act meanly, they can push them away, they can tell them that they're no good, or that they're terrible kids, or they're not as good as their siblings. Um, and then when they do try to work things through, there's such emotional outbursts, threats, upheaval that it feels unresolved. It doesn't feel good. It feels anxiety provoking. It makes people feel like, am I the crazy one? Am I looking at this right? What's wrong with me? And the amount of angst and anxiety that it can bring up and elicit can make people feel like I just can't handle this anymore. I've got to pull away. I've got to take care of myself. I can't be immersed in this kind of negative pattern. And it can also come as a perceived betrayal or rejection. It feels like, why wouldn't my mom or dad, why wouldn't they work with me and try to do everything they could to meet my needs or to listen or care about me? And if they can't, then maybe it has something to do with me. And then, we go down that cycle of really needing help and support for those clients.
Yeah, Stephanie, so I have an example for this. I had a client who grew up with a mother who has borderline and or who is has borderline personality disorder, who was diagnosed by her therapist. Um, and after every argument, her mother would threaten self-harm and leaving her with just this constant state of anxiety, like she was at fault, she was causing it. And the mother just could not emotionally regulate at all. And as an adult, she had to really limit contact with her, keep everything very surface like, and was always so afraid that her mom was going to commit suicide at one point. There were some attempts at different points, but all attempts that Emma found. So they were attempts with a like an out of a I'm swallowing pills, here's the bottle, and 911 is called immediately right then and there. Um, going to take something and putting a note in the bathroom when she's taking a shower. So more cries out for attention. And so as an adult, she had to really just completely learn how to separate herself and set boundaries and not feel bad or guilty about it, because she couldn't go through that emotional upheaval anymore, especially having her own family and now having to take care of her mother as well. It's hard and tricky sometimes what people have to deal with. You want me to
No,
continue
I
on
can do
this
it. I
one?
can do it.
Okay.
So then we also wanted to talk about narcissistic personality disorders and its effect. So again, some of the core features of this for people who are dealing with this with parents is grandiosity and a need for admiration, lack of empathy and an ability to invalidate others' emotions. You can see these threads and these themes that keep arising over and over in all of the information we're giving, manipulative tendencies and exploitation of others. I mean, these are all things that our clients come with us that they're dealing with, that they don't know how to navigate, that bring up all kinds of difficult and sad and upsetting feelings, and make those relationships with those parents or vice versa very, very painful, difficult to figure out, difficult to reconcile inside. And it makes them confused and upset and needing to talk it through and needing to figure out, how do I handle this? What is my best way of managing this? How do I ultimately make a decision about how to include or not include this parent in my life based on all the stuff that I have to deal with, between the emotional invalidation and the gaslighting and the denial of past hurts and boundary violations that all come with this narcissistic type of behavior. So these are all things that our clients are going to keep coming to us with and asking of us and working through and having to sometimes make the decision about estranging because of.
Yeah, and I like as you're talking, it's bringing up another client I was working with just as an example. I had a client who was very into triathlons and biathlons, and that was actually a bond that she had with her father. We came to see that her father most likely had narcissistic traits, was not diagnosed by a therapist, and I was not diagnosing him. but he would just frequently criticize her achievement on how like what place she came in, how she was training, and would really dismiss her successes unless it was about like every time they were out, it was always, oh, my daughter does this and my daughter does that, which, as we know, was more about him than about her. Because when they were together, it was more about the criticism of how she was training, how she wasn't coming in first in different parts of the race, what was happening to her, injuries, and all of that. And if it wasn't about him, and if she didn't listen to him, he would push her away and dismiss her, and so she had to just slowly distance herself from him and really just create a healthier boundary, not really talking about it, not talking about what races she was in, and what they shared together and what she loved about it. She had to kind of separate from because it just got to be really detrimental to her ability to feel okay about herself and about her accomplishments and achievements.
So we just wanted to go through some other personality disorders quickly, and then we're going to break for our break. So this is histrionic personality disorder. The core features of this, again, I think there's very similar reasons. I don't think we have to go through the impact each time in the slide because I think we all understand now that these personality disorders have impact on family dynamics, but the core features that really can make a very problematic result or consequence on these family relationships are their excessive emotionality and attention seeking, dramatic and exaggerated responsive to perceived slights, difficulty maintaining authentic connection. This like level of extreme sort of ways of handling and getting upset about things can induce all of these feelings of guilt again and feeling worthless and worrying about not being a good enough person. And it creates a lot of chaos and again, violating boundaries and needs of children.
Yeah, and with this, I find there's a lot of blame of, why do you do this to me? You make me feel like this, and you're making me sick, and you're making me ill, and then we have a lot of guilt on the other side, which then leads somebody to potentially create these boundaries. But remember, this bigger than life, kind of exaggerated response, and it gets to be too much. Sometimes parents don't care if they're out in a restaurant, if they're out shopping. People feel sometimes embarrassed due to certain behaviors and feel like they really need to start limiting how they're with them, when they're with them. Most of the time, remember the ages and stages. This child has grown up with this behavior, has been embarrassed at times because of the behavior, has made to feel like it's their fault or, at blame for the parent getting sick or not feeling well or getting upset. And remember these personality disorder traits, sometimes there's overlap in multiple ones.
So
So
antisocial personality disorder, the core features that we want to understand are going to, make an impact are disregard for others' rights and feelings, deceptive, manipulative, and harmful behaviors, lack of remorse or accountability. Again, these are where it exhibits itself as abusive or exploitive behaviors. It's when, there's chronic legal, financial, or substance abuse issues that destabilizes the family. There's all different ways that children feel extremely disappointed, extremely uncared about, extremely, hurt, disappointed, confused, upset. They can't imagine that parents would do this to them. They don't understand and then the parents are not willing to take accountability, aren't willing to, say they're sorry, don't seem to have empathy for what they've done. And they just create this level of chaos and disruption and instability that the child can over time just get so tired of and feel like they just can't handle anymore.
yeah, and yeah, I have a couple of cases coming to mind, but like one where there's just this history, this adult I was working with, his father had just this history of just these financial scams and like manipulated family members for money. And my adult client, the adult child, was a part of that throughout his whole life. And he just said at some point, like, I can't be a part of this anymore. I can't hear it. At one point, the father wanted him to join in some of his behaviors and decisions and a role in what he was doing. And my client really just had to separate himself. Sometimes we also see a lot of infidelity. I've had adult children who have told me that I knew about my parents' affair with somebody else, and it was going on for years, and I was told not to say anything, or because otherwise he would leave my mother, and then if he left my mother, what would happen to me? So we've seen, whether it's full-blown personality disorder diagnosable, or these wonky traits that sometimes people have, and behaviors that they engage in that now involve children in these really hard adult situations. And then the behavior continues throughout their adulthood where they say, I can't anymore. I need to separate myself from it.
Yeah. Okay. Let me just admit that person. Okay, so we want to, when it comes to the clinical aspects of things, recognize that estrangement, again, is often an act of self-protection that rather than a desire to harm the parent, although we know that it can, in fact, bring up lots of grief and loss for the parent and a lot of upsetness on the parent's behalf, we know. Assess the client's safety and emotional well-being when discussing potential reconciliation and separation. We're actually going to get into that, how to actually assess for that. We have like a whole section on assessing for that and making sure that because the point is you want to go in depth with this client and make sure that you really understand in depth what they're dealing with and what the potential consequences of reconciliation or separation would be for them. That it is a long, ongoing process that shouldn't be made easily or not with a lot of forethought and a lot of exploration. Validate the client's emotions without pathologizing their decision to estrange. I think that's really important, because by that point, I think the client really is going to feel very felt and understood and heard by you and very validated, hopefully, in what they've dealt with and why they're feeling the way they have. It's really important that we provide psychoeducation on personality disorders and family dynamics to them, giving them information, statistics, research, helping them understand that they're not alone, that, a lot of what we've presented today is, are lots of multifaceted reasons why they are where they are. That's a really important part of this process, to really give them as much information as possible for them to understand things and make a good decision for themselves by supporting their autonomy and empowering them to determine their best path forward. Again, it's always about what's the best thing for them, not for us, not for what we've dealt with, not because we made a decision either way or that we have our own set of values, that we're truly on helping them determine their situation and their own individual path.
And we'll give you some resources a little later on. But Stephanie, as you were talking, I just started reading a book I think the title is I'm Not Crazy, It's My Mother. And it's about daughters of narcissistic mothers specifically. Although, as I'm reading into it, it could kind of apply to daughters or sons, but I haven't gotten fully into the book. And that psychoeducation piece is really important because I find that people who have parents who have either narcissistic traits or diagnosable, not narcissistic, personality disorder traits and or diagnosable personality disorders and grew up with this parent come with so much confusion, and they don't really know what's up, and they come with, am I crazy? Is this me? I don't know. and it's real. And so helping somebody to kind of with this psychoeducation and just saying like, does any of this fit? Having some go-to information that they could read, short information that they could kind of just digest, and then maybe some longer books or information that could help them with a deeper understanding might be helpful. And we'll provide you with some resources also on that. Okay, so I
Well,
think,
I
is this
think
where
this
we're
is,
going to take a break?
yep, this is where we're going to take a
Okay,
break.
there's somebody coming in, I'll admit them. We know that there have been also a few questions. So,
We were going to start with Q&A when we get back.
yeah, we'll go through some of it. I know we've addressed some of it already, and we'll go through some of it. So it's 12:05, so we'll take a 15-minute break. So 12:20, we'll be back. Everybody grab your snacks, go walk around, do a stretch, take a lot of deep breaths, especially if this is impacting you personally. Yeah, hopefully at the end with the clinical stuff, it'll help to make
And
it.
yeah, we'll try to get to them all. And also, this is your opportunity if you want to put in some questions in the chat before, during the breaks so that we can also answer them when we return. Okay, take
Okay, we'll
care.
see you
We'll
in a
see you
bit.
soon.
Welcome back.
Elise, do you want to read from the chat and then we can like alternate answering the questions?
Yeah. Um, okay, I want to grab the ones that are definitely pertinent to what we've been talking about, but um, okay. I'm just trying to go back. A lot of good mornings. So there was a question about what prompted us to train on this particular subject. And I think we encounter it in our practice, both Stephanie and I. Um,
What, I'm sorry, which
there
question?
was what prompted us to train on this particular subject.
Oh, okay. Yeah.
Yeah. And we were trying, as Stephanie said, we have a whole bunch of, we have a series of trainings on divorce, and this kind of aligned with it when we were exploring topics. And we found that this comes up a lot. Like I said, whether it's direct or indirect, it seems to come up a lot in practice, whether it's, my brother doesn't talk to my mother, or I don't speak to somebody, or we're going to talk about intergenerational trauma and why this is okay. My mother hasn't spoken to her brother for years. So it comes up a lot, whether as a primary issue of, I have a client now who I've mentioned who her mom is narcissistic and was diagnosed, and she just is like questioning, like, how do I set boundaries? How do I take care of myself? And what do I do? There's also some histrionic tendencies. There's some borderline tendencies from what she's saying. And she was just trying to figure it out. So sometimes they're coming to you with it as a primary issue. And sometimes I'm finding it comes up as a secondary issue. I experienced something not like this where my brother stopped talking to me for a bit, and I didn't know why. There was something that his wife wasn't happy with, and then he just wasn't allowed to talk to me anymore. So we couldn't, unfortunately, resolve the issue in a healthy way because that was his decision to, align with his wife, which I totally respect. But unfortunately, it created a little bit of a wedge. Everything is okay now, but it was a couple of years my kids didn't interact with their cousins anymore. So, as therapists, we're not immune from this. It happens to us. I had an issue where friends stopped talking to me. We were friends for years from New York to Florida. She was like my bestie. She took me in when I moved to Florida. My kids went to the school where her kids went, and everything was great. And I would watch a pattern of behavior from her where she would cut people out of her life. And literally, there would be a thing that happened, and she would be done with them. It was never me, and we were still really good friends. And then it happened to me. So then I was the one who was out, and I'm sure Stephanie could, we all have a story. And it doesn't mean that there's anything wrong with us. And it doesn't mean that I did anything wrong. If I made a decision that impacted my brother and his wife, I'm still okay with my decision. And I'm okay with them separating from me because of my decision. Come later to realize that it was somebody that was feeding my sister-in-law information that was stirring the pot or inaccurate. So she was getting information from somewhere else, I later came to learn. So sometimes it's just something simple, but it doesn't mean it doesn't hurt and I don't feel something. It doesn't mean that me and my brother weren't victims of the person, and my sister-in-law were victims of the person that shared inaccurate information and made things worse. Um, so it's hard, and family dynamics sometimes are really wonky. I'll share it was my stepmom actually who did it, and it's hard. So, we all have some wonky family dynamics, and so when you talk about like what prompted us, we all come from somewhere, and whether this hits us personally, professionally, as a secondary issue, things that our friends deal with. I think sometimes we have a real connection to the information. When Stephanie and I create information and seminars on divorce, we're both, the product of divorced homes at different times in our lives. So we bring to it sometimes information that, at least we've been touched by it, and it's a topic that, is close to us. So I don't know, Stephanie, if you want to share
Yeah, no, I
anything.
think you actually expressed that beautifully and perfectly in terms of, I think everybody experiences this in all different ways. And absolutely, I think something that we're very interested in. But then I think that, I just started to see it so much in my caseload of clients. Everyone was touched by this in some way. And I just found like there, one of the things that Elise and I try to do is we try to present and do research and come up with information on topics that aren't, as I said at the beginning, that aren't that commonly presented or talked about in continuing education conferences. Like we're trying to find, angles and topics that we know are incredibly important and touch people and are so prevalent, but that don't seem to really be that commonly talked about. And because I think people need that information, it helps us, of course, to like do the research and to look into this and to understand it too for ourselves, for our clients, and honestly for the world in many ways, so that we can help people to handle these things in ways that feel much more helpful and constructive. So I think that a big part of this topic was that I also just saw it as so prevalent, but yet so unspoken about, and that it just seemed, and there seemed to be a need to do a presentation on something like this.
Yeah, yeah. So, let me see. I'm just going down. So somebody was talking when we were talking about here, I'll read it. I would also like to add, even America, especially in the South, and poverty culture, the ties of family responsibility, the blood is thicker than water theory, sort of mentality. Even if relationships are unhealthy, there is an expectation and an obligation to keep families together, right? And she said here to respect your elders, and even at the detriment of the survivor of and now I see where the abuse is coming from. So even at the, so sometimes it is abuse, and so then we have to be careful of how we term abuse, and is it intentional or is it just a product of that person's being and the way they communicate and the way they connect with people, and the way they relate to others. So is it quote unquote, like abuse, or, what we would classically term as abuse, or is it just like a little t, a chronic trauma throughout their whole lives? So we always have to be careful of this word abuse, because does abuse involve intent, and might there, with these personality disorder traits or challenging relationships, not be an intent? And like as Stephanie was saying before, with the story with the family at dinner where the mother is ordering for the daughter even when she's in her 20s, like is that abuse? But the way the daughter sees it is, I need to be my own person and please stop mothering me. And the mother may just have anxiety because her whole life she's had to take care of this child with these horrible allergies, and her daughter could die. So I could relate to that. I have a child who's a type 1 diabetic who's not a child. He's 25 years old. But still, when he has a low blood sugar, he teaches me how to be a better mom to him. Where, he'll go grab a juice or, a piece of candy or something because he has a low blood sugar. And I'll say to him, "Oh, do you have a low blood sugar?" He's like, "What do you think, mom?" But I'm still loving and I'm still trying to be there. But I'm really aware of how this is impacting him because that's my choice to be aware and to hold back my mommy stuff and to see how my mommy stuff impacts him. So to even in this training to understand our sense of self and that sometimes, as we said, the way that adult child views it, because somebody even mentioned to where I was talking about how maybe the parent who is always critical, maybe it's the child's issue and the way that they're hearing it. So, right? So, is it my issue when I'm saying, "Hey, Josh, do you have a low blood sugar?" Or is it Josh's issue, my son, who would then say, "Mom, of course, like I've got it," and coming back at me, So, it's not about looking at blame. It's about understanding the dynamics and helping, like if I was your client, to say, you're so aware of how you're triggering him. How could you initiate a conversation like, "Josh, when I say this, it triggers you." For me, being a mom of a type 1 diabetic for so many years, it's my own anxiety. So I apologize. So help me understand how I could support you better. And that might be a wonderful conversation if I was your client to have with me, and then to prompt me to then have that conversation with my son, assuming it wasn't triggering, or maybe to even put in a piece of, "Hey, this might be a triggering conversation, but I'd love to have it so I could figure out how we could do this better," right? And so, or if Josh was your client, "Hey, your mom is triggering you. It sounds like she means well," as one of you said in the comments of, is it the interpretation from the child and the parent really means well? So how could you then work with Josh? So if you think about it, when you work with one, you're actually working with all. Okay, so we always have to remember that. And sometimes many times, we could see things before, right? We're so in tuned and we could see things before they're going to happen. We can see what might happen if we account for different scenarios. If we are working with the other person who truly has personality disorder issues or traits and really can't be, the healthy parent who's like, "Wow, I'm so sorry I'm doing this to you. Let's work on a way through it because it's not about me, it's about my child." If you have a parent who's more, it's like, "It's about me," understanding who your client is, and might you work with them a different way than you work with a parent who does not have those traits. So it's just important to understand the players and when you're going to impact change, to be able to find that wormhole that works for that client that is that you're with. So, okay, mutual recognition. Okay, I'm just going through them, so bear with me one sec. Um, Relief, yeah. So it's confusing. Somebody talked about, I think, noting that there may be some relief along with grief on the part of the parents as well, and relief, grief, and guilt. Because when something feels better and it's not natural, I'm not supposed to be okay with not talking to my children, or I'm not supposed to be okay with not talking to my mom, but I am okay with it. There's this emotional confusion that happens. And working with somebody just on that piece, on the activation around having feet in both of the emotional sides of it, of I'm taking care of myself, but this feels wrong. Working on that activation can help them to become more settled. And when we think about, I don't know how you all practice, but when we think about a SUDS level, right, the activation level, that the question is I don't love SUDS because it gives a number, and it gives a concrete something when emotions aren't always concrete, but it gives us a scale. And I guess I'm always concerned about the number because I don't love getting things to a zero, because I think we set expectations for our clients, patients, that we have to feel this way about something, where it may feel like that sometimes and it may feel like this sometimes. So I think we want to work on helping them get to a level that just feels better, because sometimes a situation is just a sucky situation.
Hmm.
Like, we have to just feel settled with being in a sucking situation where this doesn't feel good and that doesn't feel good, but this feels better, but I'm still left with the piece that this doesn't feel good. So, and it's hard because it's for us, right? Our fixers and our healers inside want to say, like, okay, we're gonna fix this and make you all feel better. Maybe if you just called your mom, you know, right? That's what we all think sometimes. And that's our own stuff to work on. And it's important for us to recognize that piece as well, which we are going to get into. Okay, let's see. Uh, So I think there is also a dynamic of the after effects of having one parent with narcissism or borderline. The other parent is the one shut out. Yes. So sometimes there's a dynamic that there's a parent with a personality disorder, and the parent with the personality disorder has a counterpart, sometimes a partner, the mother or the father of the adult child. And this child has been witness to another parent being shut out or being overridden or being, as we call it, involved in could be an abusive relationship, involved in a some sort of a relationship that is not healthy with healthy attachments. So it
Yeah.
does get very complicated, very
Yeah,
complicated.
I see that. I've seen that a lot in these situations where that other person, that other parent that is healthier can get shut out. And then, right. And then the child, like I have a situation where the daughter is incredibly close to her mom, even though she has a lot of borderline traits, I think was diagnosed with borderline personality disorder. And the mother has been effective in sort of shutting the father out over the years. And we've worked really hard on her rebuilding her bond with her father and figuring out ways to connect with him and spend time with him and be involved with him in a way that the mom has tried to push him away
Hmm.
because she's been
Yeah.
unhappily married to him.
Yeah.
So I do see that a lot, actually.
Yeah. It's wonky. So listen, there's no criteria for becoming a parent. There's no test you have to take. There's no nothing. It just happens. And then children become a part of that family dynamic. And if it's wonky, they things grow sometimes sideways, you know. It reaches to get the sunlight, when it doesn't necessarily go straight. And sometimes that reaching causes challenges. So, and we're just there to help somebody on their journey, as I say, to be better tomorrow than they are today. Do you still consider it parental estrangement when it's from the child's side? Yes. And we're going to talk about, like, even though this is about adult children, we're going to talk about the other side of it a little bit more. Um, and it's not like, so somebody asked, like, what's a percentage? So, like, I don't know, because you're not always sure where things went off or
Hmm.
wrong, or
Yeah, it
you,
takes
you
a
know,
while to explore that. Yeah.
yeah. And it's not even about, like, I do brain spotting. If you guys have never checked out brain spotting, check it out. And part of their theory is you don't have to know what it is to know that it is. And so you don't always have to know the path or the why. You don't always have to find the dynamic. We just are reducing activation on something. And as you reduce the activation, I find that the person becomes more capable of managing it, and it's really theirs to manage. So let's see, we talked about the criticism, I referred to that. Um, so somebody was talking about lack of acceptance by a mother-in-law and how it changed the spouse's dynamic with her. And sometimes like you don't know why. There may be, I don't know, my personality disorder red flag goes up with that when there's not really any real reasoning for something where somebody, it's not like something happened, nobody can explain something. Why would a parent feel threatened by a child taking on a spouse? It should be a welcoming addition to the family, and instead of this one against the other kind of thing. So remember all of the thoughts and the red flags, but when it involves you personally, it's even harder to conceptualize. And remember, we should never be our own therapists. We should never be our children's therapists, and always seek out help. It should be a lifelong journey to learn more about yourself. Um,
Elise, I think maybe we should go back to the presentation and we can come
yep,
back to these questions.
yep, because there's, I know we've spurred on some more too. So, okay, let's share again. Okay, so let's go on. We have here the myths.
Okay, yes. Sorry, one second. Okay. So here are some of the common myths. Now we're hoping that by this point in the presentation, we have debunked some of them and that you already are recognizing that these myths are not necessarily valid anymore. But our hope is that this presentation will really help you understand these ongoing myths aren't necessarily true. And when you see them or get confronted with them, you'll have a lot of information in your arsenal to share with others or yourself about why you can definitely talk yourself through these. So again, this idea that it happens suddenly, parental estrangement, we really wanted to emphasize and hope we have that this is something that usually occurs over time. There's usually something I think we can say that's like, broke the camel's back or was the last quote straw. But I do think that in general, it is a pattern of issues, behaviors, problems, whether it be the mental illness, the addiction, the controlling parenting, the violation of boundaries, the lack of validation that over time leads to intractable conflict that just feels hard to reconcile. The next one is only bad parents experience estrangement. Again, I know we've somewhat already addressed that in some of the questions and some of the observations that you've put into the chat, that it doesn't necessarily mean you're a bad parent if you experience this, that every child needs and requires something different also, and that there might be lots and lots of circumstances in which you're trying your hardest to do the right thing, to care, to respond, to be receptive, and you just either don't know how to do it differently, can't do it differently. There's too many other variables involved that have made it difficult, and that you're doing your best in terms of trying to continue to figure out and soul search and work within yourself to see if there's still a way out of this. And if there isn't, sometimes there isn't due to, all those uncontrollable factors. Again, a next myth is adult children who estrange are just being selfish or ungrateful. We know that children can feel that way, that this can be this incredibly huge angst-ridden, anxiety-ridden feeling that they're doing something that's terrible or ungrateful. And, all of the messages that we've been given, all of the values we've been instilled about wanting to be loving and caring and there for your parents and obeying your parents. But, as we've been talking about, there's just some times where that those children have to make that decision. And next myth is therapy and communication can always fix it. My hope is through my therapy and my help with my clients and teaching communication skills and teaching all different and exploring different and talking about different things that we can get to a better place with this. But sometimes it's just not possible and the best choice. and the client's choice, or the client can't take it anymore, can't handle anymore, issues around it, and that is, a decision that really, is the best for themselves and for those around them. And again, it's not always the child's choice. Estrangement is not always the child's choice. It's a combo. It could be the parents also involved in making that choice. It can be other people in their family, as we spoke about. It could be their own children. There could be, step parents. It could be grandparents. It could be, other people who have also led them to make that choice. Okay, estranged children will eventually regret it and reconnect. We hope we've also shared that a lot of times that can happen, but a lot of times it doesn't. That even if there is a regret or a feeling of sadness or hurt or loss or grief, and maybe even a want or a motivation to reconnect is just not possible and it might not happen. And we do have to work with parents around the idea that this might not ever change. This might be the reality of their situation. Social media and therapy have brainwashed people into estrangement. We'll hope that that's not the case. We know that that trend has emerged, that there's a lot more awareness and support for this in our culture in many aspects of it, and that can have a huge impact on them, on people seeing things differently. I think ChatGPT, there's been lawsuits now because they've been getting, people have been turning to AI for therapy and for input. And sometimes this stuff does lead to these suggestions. But the hope is that it's, God forbid, never a brainwashing or a convincing or a pushing somebody into that category or asking them to do it. It's truly a path that you help them develop and go down on their own. If a child estranges, the parents must be at fault. That's again related to the first one, where we know that it doesn't necessarily mean that the parents are at fault. Okay. So now we wanted to talk about the emotional impact of um, PE, as we're calling it, parental estrangement. So hold on one second, Elise. I need to just make the screen a little bigger for myself. Okay, there we go. Um, so it's guilt and societal pressures we talked about. This is, a huge part of what you're helping them with. And again, we've talked about some of this, but just knowing that this is what you're going to be presented with. These are going to be some of the emotions that are going to come to you that you're going to help process, help them work through, understand, deal with in a therapeutic setting. Guilt, as we know, am I a bad person for cutting off my parent? All of the feelings of self-doubt and concern and fear of judgment. And also this idea of all the cultural expectations in my culture, in my family, in my background, what I've been taught, what my church has shared with me, what my synagogue has shared with me, what I've heard from my extended family, what I know within, my ethnicity is that you don't do this, regardless of past harm. So how do I reconcile all of these difficult feelings, knowing that at the end of the day, this might be the best choice for me? There's also a lot of relief that can come. And somebody wrote in the chat that it can come on both sides. Absolutely. Parents can sometimes feel relief too. I was working with a family that had a very sick child in terms of having an incredibly severe opioid addiction. And there was so much they had done for him over the years. And I mean, I honestly had never heard any case in which somebody had exhausted every single option for their child to get them help and nothing really worked. And, so they had relief on their end that they felt like they had done everything they could, but there was just nothing more they could do to help him. And it also goes the other way. You will see that people are saying, I now feel safe. I now feel calmer. I now feel more at peace. My life is easier. I'm not filled with this constant anxiety and worry and upsetness all the time about having to see or deal with one of my parents or one of my family members. I wish that things had been different, but I ultimately just feel so much better and relieved with this. So that's another very typical expression of feeling you'll see and deal with. There's people will get, trauma responses and hypervigilance and PTSD like symptoms due to the abuse or neglect that might have been involved. So they might, fear retaliation or unwanted contact from parents. They might have anxiety about being pulled or manipulated into reconnection. So they might have that feeling that you have to keep helping them work through and understand. Trauma symptoms such as emotional and somatic memories of childhood wounds can come up a lot for them as they talk through these difficult relationships that they've needed to put boundaries in place for or cut off. Avoidance of various places, people, or holidays associated with that. So I know a lot of times I'll work with people around making decisions about attending family events, attending weddings, attending bar bat mitzvahs, attending holiday dinners or parties because they have to make a decision about whether or not or how they'll deal with that parent or family member that they have been estranged from if they go. And a lot of times what I've found in my experiences is that I get people to a place of either they say, you know what, I'm just going to avoid it altogether because I can't handle it, or I do want to go and I do want to be there and support and see all these other people. And this is how I'm going to handle it. And we create a whole plan about how they're going to handle it if they see that family member that they're estranged from there. So it can go either way, I think. Um, it also can have an impact on their current behaviors within their family, struggles with having a normal family culture or how they're going to interact with each other, that they have to be so guarded or so flat affect or not show emotion or not show vulnerability that it sort of changes the way they act in family configurations. It can also really affect their identity and feelings of loneliness. Who am I without my family? That, they're dealing with huge loss and grief around that they don't know really who they are separate from that it has made them sort of question their entire being because that is how they were socialized and raised to believe that they were such a strong connection to them, that blood was stronger than water, that you never you never desert or abandon the people that have raised you. So they really struggle with those kinds of feelings. There's also a loss if they don't feel like they can go to weddings or holidays or funerals because of those people or how they're going to act again there. There's a lot of fear of repeating the cycle. What if I become like my parent? What if I am like my parent? And some people overcompensate to avoid repeating those patterns, or they go so out of their way to be so different from their parents. And sometimes that's really helpful and loving and wonderful. And other times it takes so much energy because they're not even aware they're doing that. And to help them see that maybe they can, not have to go to such an extreme to be different from their own parents. You're also going to see a lot of mixed feelings about reconciliation. Um, what is the risk of reconciling versus not? Um, some fear that forgiving a parent might mean excusing past harm. So that's a big thing to work through and process. And again, many struggle with the setting of the boundaries and maintaining self-respect and looking at what that looks like. I was talking to a client yesterday, and she's the one who feels like her mother always loved her brother more. Her brother passed away. Her mother is by herself now. Her father passed away. And her mother just asks her to do absolutely everything for her. Like, I've never seen anything like it. This woman acts like she can't do anything alone. And she makes her sit with her dog. Like, if the mother wants to go out and do an errand, she asks my client to sit with her because she doesn't want her dog to ever be alone. And so my client will just be at her beck and call, and it's really, as you can imagine, affecting her mental health, affecting her marriage. And I said, I really think it would be helpful to put some boundaries into place with your mom around some of these things because I think it's, really, really depleting you in every way. And the thought of that was so hard for her. And she said, well, I don't want to desert my mom. I feel terrible for her. She lost my dad. She lost my brother. And I said, well, why don't we start with setting some boundaries around the dog? The dog it's helpful and important for animals to learn how to be by themselves. And it doesn't mean that you're abandoning them or neglecting them or abusing them if you leave them home for a couple of hours when you do an errand. And, why don't we start there? So, so there's just all these different angles and ways that we need to help people to set boundaries while maintaining their own self-esteem and self-respect and not, taking the risk of it really sabotaging and ruining other parts of their lives. Okay, and so we also know that this can have an emotional effect on the parents. So, and there's very similar themes and ways that it does. So I will go through this. is sort of the same way. So there's the living loss, the grief and loss that parents go through. There's no closure, the grief is complex. They struggle with a whole sort of grief process by Elizabeth Kubler-Ross, where we start with denial and go to anger, bargaining, depression, a long mourning process of really trying to figure out, is reconciliation possible? Could it ever occur? And really helping them with all the different aspects and angles of how that will and will not look possibly is a huge part of the work with them. There's a lot of shame and social stigma. What will people think? Many people fear judgment from their friends. I have a client who's been estranged from her daughter, and she like can't sleep at night because she's so, not only does she feel so guilty and angst ridden and goes over and over and over in her mind what happened and why this happened, but she doesn't know how to like ever really admit it to her friends or family. She feels like it reflects so badly on her, and she can't tolerate that feeling. um so yeah, so this idea that it's leads to such deep shame and failure is huge, that we have to help them work on. And people can get isolated or even ostracized if they didn't make it work with their children. And then when we go into identity disruption, many parents see themselves through the lens of their parental role. That's just such a part of their identity. They can't imagine that this didn't work out, that all that they put into it led to this result. um, and helping them with their self-worth, their self-identity, their self-esteem because of it. And this idea of who am I if my child rejects me is a central question and component of what you're going to help them with. Again, I was sharing with you this level of rumination and feelings of helplessness, sleep disturbances, insomnia due to the racing thoughts, and the social withdrawal. I've been actually coaching my client a little bit about not socially withdrawing and really reaching out to all the other relationships and people in her life that have been successful relationships and have gone well for her, so that she can, help herself cope and manage with the loss and the rejection and the sadness and the hopelessness. Now, one of the things that came up in one of the other presentations that people asked about, and this relates to this case actually, is the idea of adoption and the attachment issues that go along with adoption and children who are adopted. And in this case, my client has her daughter who she's estranged from was adopted, and she was adopted at 14 months from an orphanage in India. And so we know that huge attachment patterns and attachment wounds happen at before the age of 3, but particularly in the first year to year and a half. And one of the things I've been helping her understand is that her child did deal with a lot of attachment wounds and attachment disturbances, and that unfortunately it was a bad storm, like a perfect storm with all the different things that happened with her and her husband with this child. And that there's ways out of it actually, and they are starting to reconnect actually at this moment. But we went through a long period of just trying to come to terms with what had happened and how it had happened, but that adoption can be a big dynamic here. um and then again, helping them to learn how to rebuild their lives and helping them use adaptive versus maladaptive coping strategies. um Excessive attempts to contact the estranged child is never that helpful. And sometimes people turn to substances or unhealthy behaviors to numb their emotions to deal with it. So these are all things that we also want to be on the lookout for and help our clients through, so that they don't turn to unhealthy ways of handling all these difficult feelings. What do
Okay,
you
so in doing my research, I found this, I think it was on SlideShare, um, and it was a study that was done. And I thought I grabbed some of the quotes that were in it, because I think it drives home the human nature of this. Um, and this is like a slide about mothers and what they wished, what aspects of the relationship they wished were different. And the most commonly cited themes were a relationship that was more positive, unconditionally loving, warm and emotionally close. So this is about children towards mothers. And for some reason, I'm remembering this, I think, as daughters, but I could be off. Also, that their mother was more accepting, respectful, and less critical and judgmental, and one in which there was a greater recognition of hurtful behavior. So remember, as my example that I just gave with my son Josh, never an intent to hurt, more an intent to understand, but sometimes parents don't necessarily know. So sometimes I think about a problem as a box. And when we're standing on one side of it, it's very hard to see around it. And so sometimes as therapists, figuratively, or sometimes literally, what we do is we walk them around the box so that you can see the other side of it. Because when we say something, like I'm saying this now, I'm convicted in saying it. I feel it, I believe it, I want to say it. So we as human beings can only come from the vantage point that we're at, but as therapists, we help somebody sometimes see that perspective. And it's not always bad. So, what somebody might deem as hurtful behavior exhibited by the parent, sometimes we help with a perspective because sometimes it comes from a place of love or anxiety from a parent due to, well, as Stephanie described, this is horrible allergy throughout the child's life, and now they're an adult, and the mom still has anxiety and is still trying to help her own anxiety and help her child at the same time, but yet the child and the adult now is very capable of managing it herself. So sometimes it's about helping the parent separate and seeing how that behavior feels controlling for the child. So some statements here. I wish I had a mother that loved me and wanted the best for me. I wish my mother was my best friend and someone I could trust. So sometimes those attachments are not there or not capable of being there because the parent just is not capable. And I know we see that. I wish she could accept me for who I am, not who she wishes I was. It will never happen as I am finally at peace with myself, and she has made it clear that she does not want to accept any of the changes that I have made. So sometimes if we find that there's behavior of the, sorry, adult and from the past, the parent doesn't recognize that the child has changed. So, and here another one. Sorry, I'm gonna mute myself. I got a cough.
You want me to take over here? Or are you
Okay.
okay?
Yeah.
Okay.
I wish that she would be willing to own up to her own mistakes so that we could work on things together and have a functional and healthy connection. I love her, but I'm just not comfortable talking with her anymore since she refuses to move forward. So sometimes when we help a family member get healthier and the other family isn't, member or members aren't, it creates a disparity between awareness, health, and wanting to resolve and move forward. And sometimes the other stays stuck in the dysfunction. And now here's what children say about their dads. They wish there was a more positive, unconditionally loving, and warm, emotionally close relationship, one in which their father would stand up to their partner's spouse. And we've spoken to that a little bit when sometimes there is a louder voice and personality in the household, and the other parent doesn't stand up for or take care of. I have a client who's in her 60s, 70s, I'm working with now, and she comes from an abusive household, and the mother just took such a passive role. And as a result, never felt like she was taken care of, and that the mother was always choosing her abuser, which was her stepfather. And another one here in which their father took more of an interest in them. Sometimes, right, when we see old traditional roles of fathers not taking as much of an interest in their children, and maybe the mother does more of the raising. Maybe, especially, it depends on which generation you're working with. I wish he could see me how he enable. I wish he could see how he enables my mother and how he hurts me when he doesn't stand up for me or do what's right. I see that and hear that a lot. And then I find that the adult child I'm working with is very conflicted because identifies with the father as the victim potentially, and then doesn't feel supported. So there's always just such complicated dynamics. I wish that he had not lived a hard life and had come from a family who also had lived hard lives and all who learned to be negative people. Instead, I wish he had been more loving, caring, touching, and encouraging father. And I wish he wanted to know me and I could have experienced having a father. So sometimes the disconnect is so great that the child doesn't even feel like the father knows them or gets them. Um, okay, let's see. Okay,
Um,
Stephanie, I think you're up
yeah,
next.
so the emotional impact of parent to child, again, I think we actually talked about this just
Yeah,
already.
a lot. We have. And this is when a parent estranges themselves from the child, because we've been talking a lot about when the child estranges themselves from the parent. And honestly, it's really the same stuff because we're just human beings and we have feelings of grief and loss and self-doubt. It's all kind of the same. Um,
I
for a
also,
parent,
Elise, I
yeah,
also did somehow I think this is a little bit of repetition because I did talk about this already in the about the
you
parent to
did.
child.
Hmm.
Yeah.
Right. And we're talking about the unique properties of these dynamics. So, a adult child to parent, the relief and emotional freedom may be completely different. The guilt and self-doubt, because parents are not supposed to do this to children. Parents are supposed to stay supportive. So it's all potentially about the mindset of a parent and looking at it through a parent's eyes as opposed to a child's eyes, an adult child's even. So just to think about the difference in the dynamics and the vantage point that they're coming from is important. Um, Fear and anxiety. If this mom didn't tell her daughter, it didn't say something at dinner when they're at the restaurant, what would happen how would the parent feel about that anxiety and how do you work with them on letting go? Because the reality is her daughter can die and that's all she knows. My daughter can die if she eats a peanut. And I need to make sure that, are you sure you want to order that? Because have you checked? You didn't ask the guy, do they have peanuts here? Do they? And so the mother is like, if I don't do this, my child can die. And that's where the mom is coming from. So to think about it from the vantage point of the parent and to understand the dynamic, because we're looking at it, it's like, mom, let go already. But what is coming up for the parent and why are they feeling like they need to do this? So that's just an important distinction when you're working with the parents who either need to separate or need to understand it from that vantage point.
Yeah. Okay, yeah. So this is about, the impact on the nuclear and extended family, that the intergenerational trauma will continue. Unresolved trauma may persist across generations. I think when I do a genogram, and we're going to do like a slide on genograms and how they're a wonderful assessment tool for when you're doing an evaluation and really exploring and understanding patterns and understanding what a client's gone through historically, that's a wonderful way to assess it. But it's really interesting how I find that estrangements seem to really run in families, and for a variety of reasons, as we can imagine, but that you will see that, and that intergenerational trauma will continue because of it. Um, Family events can become strained. All of these kinds of wonderful, hopefully, occasions can be emotionally charged or require careful planning to prevent conflict around. When there's people coming together for these big events, big emotional life stage events, they sometimes, they do sometimes bring up all these other difficult relationships and people involved, and we have to learn how to navigate it from all different directions. Um, Sometimes some of the effect is silencing and secrecy. Families will refuse to discuss the estrangement, making it a quote family secret that adds more distress to the whole thing. Like, no, you can't talk about Aunt Sally and what happened with her daughter, or we can't talk about what happened with dad and his father, or we can't talk about these things. And then that can build it even greater. That can build a lack of being able to really truly resolve it and work on it or address it. It can bring up all kinds of feelings in the family about the shame around it and the stigma and the secretness of it. So we know secrets can be incredibly dangerous and really, really harmful. And this is one that can really also have a very negative and sort of long lasting malignant effect on a family system. Um, Potential for reconciliation or permanent division. Again, we know that sometimes some of these things will never be resolved or worked through, and that sometimes a permanent estrangement and division is going to be the end result for some of these families, even if some of the other family members are fine with that person and really can't stand the fact that this is happening and really are trying their hardest to intervene or mediate or work on it amongst everyone else.
Okay, so now let's talk a little bit about inherited estrangements and the impact of these. So impacted other relationships. So family estrangement affected the quality. These are some studies. Okay. Family estrangement affected the quality of other familial relationships and contributed to secondary and inherited estrangements. Um, so like there's a unique dynamic of how is everybody else affected by an estrangement. And so looking at it in a linear fashion of what's happening today and in the here and now. And then also looking at it in understanding relational patterns and what's okay. So we're looking at it of how does this impact my brothers and sisters when I don't talk to my mom? How does it impact my dad when I don't talk to my mom? How does it impact my children and their ability to be with their grandparents or grow up with cousins or what have you, or spend time at grandparents? How does this impact everybody in my life that, is now a part of the estrangement, whether they want to be or not? So understanding that as a therapist, now we have development of relational patterns, which suggests that unresolved issues in one relationship may be transposed to other relationships that create similar relational patterns. So are we normalizing an estrangement, a cutoff, I don't want to be with you? So my mom, right? So if we say that, it's not me, but if we say, Rebecca's mother does not talk to her mother. Okay. So Rebecca really doesn't have a relationship with her grandparents because of Rebecca's mom not talking to her mom. They really don't do a lot of family things and family gatherings. And so it's Rebecca is more involved with her father's side, but not her mother's side. Okay. So now Rebecca has a child. The child grows up. So this child grows up. And for Rebecca, now this is kind of this is the way I've grown up. So now when Rebecca's child is growing up and now something happens between her and Rebecca, does it become more okay for Rebecca's child to say, Mom, I'm not talking to you anymore and I'm setting boundaries because this is a relational pattern that is familiar to Rebecca's child. And when something happens, is it easier for her to cut off? Are we normalizing a cutoff as a way to resolve an issue? And then to what extent? Is it, you're always critical of me, or is it, this has grown over time and I can't deal with it? So is there a normalization, I think, is really what I'm getting at. And are we, if it happens, does it now become okay for others to do it in the family? And then understanding the implications for health and well-being. The research suggests that number of grandparents who were estranged from a grandchild suggested that this impacted their relationship with peers and their life satisfaction and role fulfillment, because now when they're with their peers and the children come to, the pool and with their grandkids, and this other person doesn't have a relationship anymore with their child. So it feels wonky for them. And it feels like something's potentially missing. I work with a lot of older adults, and unfortunately, I find this happens more often than not. And so it really impacts the way they communicate with their friends. Holiday time, I find, is sometimes really hard for them. Spring break time, even, that's not necessarily a holiday for them. But when they find their peers spending time with families is harder sometimes. And a reduction of resources. So a reduction in the physical, financial, and emotional resources available to the person who's estranged, which increases this generalized vulnerability, increases risk. Sometimes family is a place where you turn when you're in crisis. I hear so many people saying, I wish I had my mom to talk to. This is a time where I wish, this situation would be a time I would naturally call my mom, but I can't. So this reduction of resources and not having, I guess, what you idealize or what you would love to have, but it doesn't fit. And even when you go back to it with this potential cyclical kind of motion of estrangement, it's okay. I need my mom. I want to talk to her. I talk to her. It's like, oh man, here we go again. There she is in full bloom. I can't deal with this. I'm pulling back again. So, reduction of having that available for them. I think this is also from that slide share. But just some statements. As you could see, it makes me feel very alone and sad. I miss my family. Memories of happier times come flooding back. We try, right? We naturally remember the good. We forget the bad. The bad kind of fades away sometimes, and the good kind of pops out until you're in it again. Um, so these are just kind of some statements, and these are more about holiday season and times that could be challenging. Okay, we did a little Q&A. I think we're going to move past this and we're going to potentially come back to this. So we just want to make sure we have time to make sure we get through the material, and then we have some exercises we can do. Okay.
Okay, so we wanted to point out, yeah, so just so everybody knows, as you know, we're stopping at 2, so we have about 40 minutes left. And I guess, Elise, we'll leave the last 5 to 10 minutes open for questions.
Sure.
Yeah.
Yeah,
Okay.
so let's make sure I want to make sure we get to all of our clinical stuff.
Yeah. Okay, so just we wanted to point out very briefly that there's some really famous estrangements that I think has made it a little bit more socially acceptable for people to know that they're not alone. And these are people who are celebrities, major celebrities, have really brought it out in the open, out to the media that they've gone through it. So Prince Harry, Meghan Markle, Jennifer Aniston, Matthew McConaughey, Macaulay Culkin, Britney Spears. These are all, people who have all been very clear that they had to do this for their physical and mental health. Okay. So now,
Yeah. So here, so we're talking about types of therapy. You're either working with the individual, but remember, when you're working with the individual, you're also kind of working with everybody they touch. You're working with the family. You maybe have a multifamily or reunification case. And as I said here, you're working with the family unit, even if you are doing individual work.
So,
Just
yeah, so
yeah,
these were just clinical
we don't have to go
approaches.
through these, but just some basic, here's just a list, and you all have your own approach. Anything works with this. You utilize the framework that you're comfortable with. I always say expand, expand. I use an eclectic approach, and I'm sure Stephanie does too. I use a little IFS, a little brain spotting, a little EMDR know-how with some cognitive thrown in there. And the more you practice, the more you throw stuff in. So use whatever works for you. There's not a specific methodology that we would advocate for, but making sure that you have a balance of processing and cognitive and helping somebody to drop down so that they can reduce activation, as well as providing adaptive knowledge and some of that higher level cognitive stuff is important. Primary is secondary issue. So with regard to this, you want to kind of like assess, are they coming to you because they're in distress with this issue, as we've talked about? Or is this something that you're learning as therapy evolves and this could help to paint the picture of some of their core issues. Um, Okay, so understanding who is your client. And I think this made more sense when I wrote the slide than when I'm reading it now. And I do have to revise this slide a little bit. But so who is impacted? Who initiated it? So sometimes more of what I was thinking was when somebody presents to you and they come in with, this is happening to me, or I had to do this, or I had to cut it off. We're always staying where our client is at. But as we kind of assess and put the pieces together, we're maybe seeing that the client was not in that victim space as they say, but maybe there's something else going on with the client that their dynamic causes them to more feel like the victim than the situation dictates. So remember, when we're looking at it, they're coming to you with this information. And then for us, it's who are they on the receiving end? Are they more on the initiating end? Is your client more intact and the family is not as intact? Is the like what is so you're kind of like walking around it. And so when they come to you, I always caution, don't jump to conclusions, although it's so important for us to stay where the client is at. But as we do our work, we could kind of the color starts to fill in on the picture for us, and not that we are the scripters of the person's story, but we are understanding their story and all of the players and the dynamics involved. Um, okay, so here we're assessing who is your client. We're assessing their current relationship, their presenting problem, and their goals. Um, so we want to be kind of guiding and approaching differently depending upon the relationship. Were they the one who this happened to? Were they the one who initiated it? And understanding that from that perspective of where they're coming from. And as a therapist, how do we know what's actually up? Like, we really don't. We have no clue. We're hearing a piece of it, remember? And so we want to really allow things to unfold without judgment and not always with guidance. We want to be aware if somebody comes to us. Sometimes we have clients that are in such crisis that we want to just really help them with the crisis. And the crisis may be this, but we want to make sure that we kind of understand what the issues are. And we want to, are there clues assessing the client's level of responsibility? Kind of like I shared with you with Josh, of wanting to be able to do it better. Like I'm taking full responsibility for being reactive to my son's diabetes, and but so I understand my history, and that's my responsibility to work on and take care of because he's obviously an adult in his PhD program, living without me, fully responsible. But when I'm with him, we go back to he's 8 years old and newly diagnosed. For me, that's me to take care of. So assessing your client's level of responsibility, of awareness, and taking care of it, taking care of
Yeah.
themselves and how they interact.
Yeah, and Elise, I so appreciate you self-disclosing and talking about that as an example, and I'm sure so many people can absolutely relate to that. I think the difference, though, that we do have to be careful of is that you are very willing and wanting to be aware and to look at yourself and to understand it and to shift and to take that feedback into account and understand how important it is that he was able and willing to call you on it. And you recognize the importance of pulling back and working through that. And unfortunately, I know you've said this too, but unfortunately, so many of our clients, their families or their kids, or whichever way it goes, don't necessarily understand the importance and benefit of that. And so, that's where what they're up against. And it's something that, is just really painful and hard for them to work through because the parents aren't willing to shift and change and take accountability and look at themselves the way you're modeling it right now.
Agreed, and I appreciate that, and I appreciate the awareness and understanding, and so it's very, very important for us to, like, understand where somebody is coming from. And I think that's kind of what I'm talking about is we're not supposed to know what the reality is, but we're supposed to understand and help people and guide them. And yes, I appreciate your understanding that I am intact and very aware that some people aren't. Um, but that's our job as therapists to help them, as I started to say before, to walk around that box and to be able to help them see that there are other sides of it and to work on their emotional dysregulation so that they're able to do that is important. So I believe that everybody is capable in their own way. So we want to assess their emotional awareness as we've talked about the level of dysregulation as compared to the intensity of the situation. So sometimes somebody could be very dysregulated, but the situation doesn't necessarily call for it, at least as we see it from our vantage point as their therapist. So we're just kind of understanding and being aware of what somebody's bringing to the table and a discrepancy potentially in the emotional piece of it as compared to the situation. And if it's off, for us to explore that as an issue potentially. So abandoned emotions, I don't want to go there. So if somebody's emotionally shutting down, if somebody is emotionally heightened or dysregulated, and what is going on within them and where is this coming from? Are we seeing inconsistent narratives in them and in what they're saying when they're talking about their family members in one way, but they're also describing that other family members don't feel the same way. So is what they're saying one day going in one direction and then they come to you in the next session and they're going in a different direction. So are there inconsistent narratives within their presentation we want to be aware of? We may have to help people to get emotionally healthier, more regulated, more in tune with becoming more aware before they could take responsibility and see how they contribute to a situation. And some clients may resist in exploring their role and accountability and are only able to stay on one side of that box and not able to move around until we get them potentially or help them get to a space where they could see things. Okay, so Stephanie,
Oh,
here's the
yes. Yeah,
timeline.
I'm ready. Um, so yeah, and so here's, some of the ways that we actually want you to actually, think about doing it more logistically. So it's important to explore the timeline, to really understand it, to get all sort of the pieces, quote, in the puzzle, to understand like the dates and the distance. I mean, not that we have to have this perfectly, documented identically, because as Elise was saying, the reality is not necessarily the important part. It's the understanding the big patterns and the emotional issues and how they've come to understand it and get to it. But we do want to understand all of what sort of led to it. And that requires understanding the history and the background and all those other factors. And we want to make sure we're assessing for generational traumas and assessing for other estrangements. And again, as I've said, almost always we find that there's generational traumas, whether it be a client I just had whose, grandparents were Holocaust survivors to, other traumas of family violence or family abuse or sexual abuse or some had been abused by clergy members, or some people had been neglected because their parents had so many children when they were growing up. And then again, there does seem to be a pattern in these cases with other estrangements that are important to understand and look at as well. And then again, like I had shared earlier, the genogram is such a wonderful tool to be doing this. It just gives you this quick visual with lines and circles and broken points, or I put lines through to show that there was estrangements. It just gives you this visual of somebody's life and their past and their family tree that just helps you understand where the conflict, neglect, favoritism, the key issues that might have led to this come from, or repeated patterns that this person is dealing with that might not even be related to what their parent had done, but it's very similar and triggers all the same feelings. So, anyway, this is just a wonderful tool that we highly recommend. And then these are some of the actual trauma. This is through a trauma-informed lens. This is what we're asking you to think about. And these are some of the very typical examples of questions to ask. Was there physical, emotional, or verbal abuse with this parent or family member? Were your needs consistently met? But of course, we're going to ask that in a more in-depth way with other questions that go along with it. How has the client historically connected with caregivers and other relationships as we're trying to assess their attachment style and patterns? Does the client display avoidant, anxious, or disorganized attachment behaviors? Does the communication with the estranged parent trigger anxiety, depression, or a trauma response? Are there signs of hypervigilance, dissociation, or avoidance in family interactions? And then we're looking at the different coping mechanisms of this and how have they been able to cope? What strategies have they used to manage all of these difficult feelings around these issues? And a very important question at the end of the slide is, do they have a supportive network outside of the estranged parent? That's something that's helping us decide if they do fully estrange and don't reconcile, will they have other people around to support them? Other questions we want to ask are, who are the individuals involved in the estrangement, of course? What roles do they each play in the conflict is a huge question. Are there allies or mutual partners who influence the situation? That's the ideas. Are there extended family members, grandparents, step parents, new spouses that sort of, influence and are involved in this in a way that's really unhelpful and unproductive? What are the core issues and triggers that you need to be aware of? Are there unspoken expectations or values that contributed to this? Emotional and psychological factors. How does each party perceive the conflict? What trauma or unresolved emotions are influencing the reactions? What attachment styles are at play? So these are all just really great questions and thoughts. Communication and power dynamics are important to be looking at. Is there a history of controlling behaviors, gaslighting, or manipulation? Who holds the emotional power? And then what have the attempts of resolution and barriers to healing look like? Have there been previous attempts? What happened before? Um, what barriers continue to prevent reconnection or reconciliation? And do both parties want it? And what's the most healthiest option? Or is maintaining distance the healthiest option? So these are all important things to be asking.
So here, we have some sample questions that might be helpful for you. For parents, how would you describe your relationship with your child before, the estrangement? What do you believe caused it? Have you tried to reach out? What happened? What emotions come up when you think about estrangement? So, working on the dysregulation within them. And also, same thing for adult children. What prompted you to distance yourself? How did your upbringing affect your decision? What do you need to feel safe? Have you communicated with your parents? Why or why not? Um, and so here's some unique countertransference issues with parental estrangements. For us as human beings, it's not natural for families to split up. It feels off for us. We want to right what doesn't feel right. So we're human beings first, remember. There's an awareness of a therapist's personal background, norms, values, relationship, and in their own families of what happened. What do I bring to the table, as I shared with you, when my brother stopped talking to me for a bit? So, what is my background that is going to contribute to a client that might have a similar story or history? And how does that impact me? So, we always encourage people to do their own work, do their own work on their issues, do their own work on specifically, you could do it on countertransference issues. What I do as a therapist sometimes when I'm working with a client that triggers anything in me having to do with PE or not, I have a little paper that I write down because I need to take my own stuff away from working with a client. And I write a little note to myself of to work on with my therapist and, just things that are triggered in you. So you want to be aware also of any bias that you have based upon the reality versus what they would like to have happen in this person's life, because it's typically based on what they would want in their own life. So we want to understand these unique countertransference issues with this. And looking at estrangement sometimes as relief, healing, and growth. A little statement here of realize that I can't change my mother or make her any different. I'm sad that I don't respect her and that I do not have the relationship I would like, but I've accepted it and I'm making a new traditions for my family so that I do not feel the loss as much. And sometimes, although setting boundaries with family members may be necessary, as I've said throughout the presentation, it's not always easy, but sometimes it's essential just to becoming a healthier, emotionally healthy human. And it's sometimes being protective and it keeps the toxicity away. So, maintaining an estrangement and ambivalence after. So this is just a statement I think that drives home this concept, which is, I mean, the amount of times I wanted to contact, I couldn't even count for you, like hundreds of times. But something in me just prevents me. I cannot, my fingers will not dial that phone. Like the hurt it's just so deep, I can't bring myself there. So sometimes for people maintaining this, and we might look at this, looking at it out of context of like, okay, so does she want to? What's stopping her from doing this? That might be a side that you explore. But what I also see in this is strength. And I see this one foot on both sides, but the foot on this side feels better and feels safer for me. It sometimes really requires an enormous amount of physical and emotional energy. So remember, it's being aware of your own bias, your own idea of family, of what you as a therapist would like to see, and how that's your issue and not theirs. Um, so it just to be able to see why somebody or how somebody needs and the struggles they have with maintaining it, and seeing it as an option. If somebody's not estranged yet, somebody who's actively in a relationship that is really unhealthy and dysfunctional, we unfortunately see it all the time. How to set boundaries, how to like see if boundaries helps, and what does it look like, and how do we kind of do it, and then talking about once again. with when we're doing the work with our clients, it doesn't have to be an all in or all out. It could be boundaried. It could be just not responding to texts immediately. It could be helping them understand or see the emotional dysregulation in a parent, and then when they see it, how to not get anxious themselves and respond immediately, but to take a moment and step back, letting the parent resolve their own issue, come back to it like, hey, I saw you were upset. Is like how to not step in it again. And what does a boundary look like? So sometimes that's the first place that you start with this adaptive knowledge. What are the therapeutic steps if somebody wants to move towards estrangement and they feel that that is the only healthy option for them? Helping them kind of with some sort of a roadmap, either a hard roadmap or a loose roadmap or anything in between, to help them get to where they need to go in a situation that for them feels like the estrangement is the only option. And the continuum. So personality disorder abuse, as we call it, or features that lend themselves to these really dysfunctional and unhealthy patterns. Um, can you accept who they are and all they come with? Can you boundary enough to keep yourself in the relationship? Or what do boundaries look like, and how could you boundary yourself so that you can create some distance but stay in the relationship? So it's not, as we said, an all or nothing, it's a continuum. If there's child abuse, I've had clients who said that either they were the victim of child abuse and the parent that they want to engage with was also the victim of the abuse from the other parent or step parent, but they're not necessarily feeling like they want to leave their children with that parent because they don't feel like the parent is safe or could set boundaries. So, um, but I still want to be in my parents' life. So how do I do it? When my mom says I could babysit and I'm not comfortable leaving her with my children or leaving my children with her, how do I set healthy boundaries? Thanks, mom, but let's just visit this time. And, I've decided to hire a babysitter. And what does that look like? And how do we talk about it? Um, even sexual boundaries. Sometimes it's just weird. Sometimes with dementia, there could be um, uncomfortable situations. There could be, as we said, past abuse, parents who don't understand boundaries, other family members. I had somebody I worked with where the grandfather was inappropriate, and so when she would go to see her mom, but the grandparent was going to be in the mix, that became wonky for her, and she couldn't bring herself to attend Thanksgiving, but actually never disclosed to her mom what happened. So when we talk about this continuum and how to help somebody with the pieces that they're struggling with. Um, Okay, and helping somebody with how to take care of themselves if they decide to engage. And if they decide to engage in the relationship, once again, we're talking about these boundaries, which I've discussed. And the hidden cost of estrangement. There's emotional issues that, as we've talked about, it extends to other family members. It extends even just individually. Where do I go for the holidays? Or I don't see my kids for the holidays. So it extends out. Okay, and I think.
So now we're going to talk about ethical issues and parental estrangement. So, of course, when we're doing things, we want to do things as professionally and as ethically as possible. And one of the very first important parts of that is to have a general understanding and knowledge of parental estrangement. So I think this training was probably, hopefully, a really good introduction and start to that. And so we would just encourage you to keep reading and learning and knowing as much as you can as you're working with these cases so that you feel like you are as prepared and as, knowledgeable as you possibly can as you help people through these issues. And then that also relates to securing other appropriate trainings, further trainings, other approaches, and things like that, so that you just feel that you are, you're in touch with your countertransference, you're in touch with your own feelings, you're really truly on a path to help your clients going down their own personal and autonomous path and not your own, and that you're not putting in your own values or, inserting your own issues into it, of course. We want to make sure that you're not doing inappropriate advocacy. As we all know, this brings up enormous amount of issues. I mean, I think we're in this field because we care so much about relationships and family and healthier ways of doing things and breaking cycles and, really trying to help people get to better places in their life and how to heal from really difficult things. And so we have to make sure that as we're working with them, that we're not inappropriately advocating for one position or one person or one issue, that we're staying as, as neutral and as open as an objective as we possibly can as a human with all of the things that we come to in the world with the work that we do. We want to make sure, of course, that we're getting informed consent. Of course, you want to make sure that this is truly their decision and that it's voluntary to come to you and that they really truly on their own want to work on this stuff, that they're not being coerced by anybody else, and that they don't feel forced or pressured to be working on issues that don't feel real and important to them. Of course, we want to follow all HIPAA regulations in terms of safeguarding electronic and written communication, and that all of our records are extremely detailed and efficient and clear, and that there's not too much of a over discussion of any one detail to ever, if anybody does ever subpoena or take these records for whatever that reason would be, is that anything in their life would be horribly, obstructed or brought out in a way that we would never want to affect their confidentiality. If we do, I am a family therapist, a marital therapist by training. I do bring in other family members in these circumstances. I'm comfortable and happy to bring in spouses to do couples work around it. I'm happy to bring in extended family, not necessarily extended family members, but mothers or fathers or other siblings into this. I'm comfortable doing a multi-family session. So, but we have to make sure that confidentiality is absolutely in place, or that we have clear understanding from them that it's okay to share. I actually have a case where I'm working with the father. I believe there's been pretty strong parental alienation against him by his ex-wife. His two sons talk to him, his daughter won't. She finally agreed to meet with me alone. She told me it was totally fine to tell her father anything she shared with me. I reported to him that the brothers had told her stuff that they were upset about the father. And I said, "Are you sure it's okay for me to tell him this?" Because he wasn't aware of this. And she said, "Absolutely, it's fine. You can tell him." Then he went and said something to the brothers. And then she reached out to me and she said, "This is making things worse. I didn't really want him to know." And I was like, "Oh, well, I thought you had told me that, it was totally okay." So we have to be very careful. And then she was like, "I did, but now I realize I shouldn't have said that." So these things can get extremely tricky. We also want to be aware of issues of financial gain, of course, that we're not just having sessions or doing things so that we can make money, especially for those of us in private practice who do benefit financially from multiple sessions. And avoiding and addressing the countertransference issues is obviously incredibly important to the ethics of this.
And Stephanie, I just want to kind of add to what you were saying before. So remember, just because a client says to us, you can share everything, we also have the right to professional judgment. And I'm not saying you were off with your judgment, Stephanie, but just so you know, because I always talk to my clients about what is the purpose, and also
Yeah.
what might be the repercussions.
Yeah.
In some situations, I have the family present and I actually have the family members say it. So it's not necessarily coming from me. So always be aware.
Right.
And
I know. I
I
always
know
think
what
that.
I know you, and I know this situation was not that, Stephanie. But, just in terms of how we conduct ourselves in general, I have patients that say I could share everything, and I say, well, I'm not.
Right.
and I'll
No,
say like, yeah,
absolutely. You definitely have to make judgments. I was trying to help the situation because she actually thought it would be important at the time as she was telling me this, that it would be important for her dad to know this. And I went over and over and over it with her to talk about all of the consequences, the importance or not of sharing this. So we did, I was saying this a little quickly, but we did go
yeah,
through
I
it with
figured
a
that.
long
I figured
time to
that.
decide if that was the right thing to do. Yeah.
Yeah, I figured you did all of that, but you didn't share it, so I just wanted to make sure. Um, but I knew you did that. Okay, so I'm gonna stop share now. Um, and I want to just kind of go over some of the other questions you guys gave. Um,
I'm not seeing like a lot of other questions.
mhm. So, how to approach a spouse who is aware of enmeshment, toxic relationships between their in-law and spouse, but the spouse does not see it as an issue. She is unwilling to jeopardize this being exposed to her daughters. So we have a spouse who is aware of the enmeshment and toxic relationship between, I guess, the in-law, the mother-in-law, or in-laws and their spouse. But that your spouse does not necessarily see the issue and the enmeshment. Sometimes that could be addressed in marital or couples therapy. You could grab it that way and see if they want to participate. If there's no awareness and apparently the spouse is being impacted by it or seeing something that's not comfortable for them, addressing it as more of a relationship issue and how the spouse is seeing it. And if the spouse is your client, it might be helpful just to work with them on the deactivation of the issue and being able to communicate with their spouse in such a way, um, and maybe say things in such a way so maybe they could hear it differently might be helpful. Um, I know we're nearing the end. Alex, I see you on. I'm just trying to look through, and Stephanie, if you see any, to see if there's any more. With narcissistic, isn't it possible that abuse doesn't require intent, since oftentimes the parent will never admit wrong or change? Yes. Sometimes you are working with a brick wall, and then that's when you help your client to be able to understand that dynamic and be able to make choices based on that. So the elephant is always the elephant. The elephant is never going to be a rock. It's never going to be a flower. It's never going to be a water bottle. The elephant is always going to be the elephant. If the elephant wants to change into a rock or water bottle or flower, awesome. But understanding and helping your client see the elephant is always going to be the elephant. So how do you want to interact with that? And
Hmm.
that's really important.
I
Helping them,
agree.
right? Because there's always a hope of maybe this time my parent will get it. Maybe this time they will see me. Maybe this time when I show them this, they'll be proud of me. Maybe when I lose the 20 pounds, they won't be so critical of me. But the elephant is always going to be the elephant. So if it's not about the weight, the criticism may come about something else. So there's always this thought or hope that something will be different. But the elephant always ends
Right.
up being the elephant.
No.
Just kind of is.
No,
So,
that's a very good analogy. I appreciate that too.
yeah.
So somebody wrote here something when the pain of the same becomes greater than the fear of the change. When is enough pain enough pain? Pain is a great motivator. And that's very true that we can utilize that. I mean, and people will come to us at points of pain. And, I was always sort of trained that people come at chunks of time in their life when they're hitting these pain points. And it is our job and our, sort of role is to help them through these times and to use that as a motivator for them to really look and understand and figure out what they need and how to manage it and how to handle it and how, like you said, Elise, understand that that things might not change. And with that, how do you make it the best decisions for yourself, and how do you go down a road of whatever decision works for you around this, but then what are the consequences? What are the benefits? And what are all the things that are going to come from that decision?
Yeah. So really what I want to say is you guys rock. And I'm so glad that you're here. And I'm so glad that you're learning this because this is so not easy and this is so complicated. And I wish I could say that Stephanie and I have like a roadmap and a plan for you, but I'm hoping that you took away a piece, right? If we all from each seminar gain one little thing that we could really utilize, whether it's in our personal lives, our professional lives, or both, then we're all ahead of the game. So I encourage you to keep learning.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.